County Board of Supervisors to order, please. We will start with the Pledge of Allegiance. Please remain standing. Following the Pledge of Allegiance will be a silent moment of reflection. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We will have the reading of the notice, please.
An educational meeting of the Marathon County Board of Supervisors will be held at the Marathon County Courthouse Assembly Room, 500 Forest Street, Wausau, at 7 p.m. on Thursday, August 17th, and the agenda was duly signed and posted.
Thank you. I would like to request everyone please silence your cell phones and any other electronic devices as to not be an interruption to the meeting, and I thank you for your indulgence. We'll move on to roll call and ask everyone please sign in. Thank you, and we will proceed to welcoming all of the visitors that we have with us this evening, and thank you for your interest in county government. And we will move on to public comment. We have two individuals who have signed up for public comment. First, we have with us Eric Donaldson. Eric, if you would, please come up and use the mic.
Hello, my name is Eric Donaldson. I am the director at Rib Mountain Metropolitan Sewerage District. We are a wastewater treatment plant that serves Rib Mountain Sanitary District, the Village of Weston, the Village of Rothschild.
Eric, could you step a little closer to the mic?
Sure.
It's not,
Yep.
Thank you.
Okay, I'll repeat that. My name is Eric Donaldson. I'm the director at Rib Mountain Metropolitan Sewerage District, and we are a wastewater treatment plant that serves the communities of Rib Mountain Sanitary District, the Village of Weston, the Village of Rothschild, Village of Cronenwetter, and the City of Mosinee. We have a 5-member commissioner board that serve 5-year terms, so every year one commissioner is up for renewal. And this year, Craig Mortensen was up for renewal, and after the July supervisors meeting, I found out that Craig was not confirmed and that we needed to look for a new commissioner. Well, everybody at the Metro, the employees and the commissioners were surprised and disappointed, and we searched for a process to have Craig appointed. We wanted Craig to continue to be a commissioner. At our July meeting, the commissioners, the other 4, voted unanimously to recommend Craig to be a commissioner. And then after we found out that Craig was not confirmed here at the supervisors meeting, we solicited letters from the communities, and I have those with me. Letters from the communities, a letter from Craig, and also at our August Metro Commissioner Board meeting, the commissioners re-voted unanimously to recommend Craig as a commissioner. I watched the video from the July supervisors meeting, and there were 2 comments about Craig in there. One was that he shouldn't be a Metro commissioner because he doesn't have a connection to the sewer. Well, 2 responses to that. One, the statutory requirement for being a commissioner is that you live in the district. Craig lives in the district. Also, we do accept hauled waste at the Metro, both holding tank and septic. So you don't need to be connected to the sewer in order to be a customer of the Metro. The other comments that were made that Craig did not perform for the village of Kronewetter residents when it came to the manganese issue. And the letters that I got, especially the one from Kronewetter, addresses that best. But I can tell you that Craig has served the Metro and the Metro communities very well for over 6 years. We rely on his experience as a business owner to help us with the contracts that we sign with people for construction projects or vendors, and that Craig has performed very well for the Metro and the communities that we serve. So I guess the only question I have is I've got copies of all the letters, and I just don't know who to give those to, or if I should pass them out, or any direction. Just hand them out.
Yeah, Craig, just go ahead and hand them out, and they can circulate them around the tables. Well, thank you, Eric. We next have Bob Stavron. Bob, please.
Yeah, Bob didn't make it.
Oh, Bob didn't make it? Okay. Okay, that's all we had for public comment, so we will move on to item 8A, standing committee chairs or designees. Any announcements? I will make a couple of announcements. First, had a discussion with the vice chair, just to give the board an update. Craig's going to be released from the recovery and rehab center on Saturday, and he will be home and continuing his recovery and rehab. And so our best wishes are with him and his family. I also have going around for the board a get well card. If you wish to, you're more than welcome to sign that, and then we'll get that sent to Craig. Also, there has, when we transitioned to the new website, there was some links that had discussions and had conversations with several board members about the links being broken, the old links on your iPad and the Good Reader. That is being worked on by CCIT. They have and will be forwarding out communications with and it has to do with the ability of the new website, but they have identified a process to be able to continue to allow individuals that choose to use the functions of Good Reader with their program packets. There'll be a little bit of a process in educating each individual, and there'll be a email going out with some instructions on how to do that. Also, if there is any challenges, by all means, reach out to CCIT. They will provide information after that link comes out and that information. But we also have with us individuals from CCIT if anybody has specific questions on that. With that, any other standing committee chairs or designees? Okay, we will then move on to item 8B, and that's an update from North Central Healthcare Administration. And we have with us the Executive Director, Gary Olson. We have the Finance Director, Jason Hake, and we have the Director for the programs, Vicki Tilka. So, Mr. Olson, if you would, or the team.
Well, good evening. Thank you for allowing us to come and present to you this evening. What's the best way to do this like that? Okay. So the I want to just kind of start off with this to give you a little bit of an overview of us as a team. So I'm the executive director. My name's Gary Olson. I met you last year during budget. I myself have 29 years in government, most of it county, except for the 5 years I was at the Village of Rothschild. And Vicki Tilka, as you know, was with Marathon County, and Jason Hake, he was with Portage County, and he's been with Lincoln County and with Marathon County. We have a very strong senior leadership team at North Central Healthcare that's different than anything. When I spent 16 years at Langlade County. We're part of the Tri-County Agreement. And the one thing that I have to say now is you now have a leadership team at North Central Healthcare that understands that North Central Healthcare is county. We are county government. So we are an arm of you. And I think that that is really important because we have such strong county experience now. You know, the bad thing is it's North Central Healthcare, but really we're the community programs for the 3 counties. And I think now, more than ever, you have a strong leadership team that understands that and knows that. And I think that that's really important because with that, it's helping us to build connections. Connections with the Tri-County leadership, the board, social services directors, and administration. And when I was at Langlade County, that was one of the things I thought was really lacking, was that ability to have that connection to understand that we are county government. And that is really big and important because our collaborations with our partners and stakeholders, that's the number one thing that we need to do is to have those collaborations to be able to take care of all the clients that we need to take care of because the programs that we do for Marathon County as your Department of Community Programs, a lot of them are mandated by the state. And so it's our mission to provide that quality human services that we have. We're just an arm and a branch of your human services that you have. So I wanted to stress that. I'm going to turn the mic over to Vicki so that she can give you a presentation on our programs. But I think it's very important as we look at this that, you know, for me, I fully understand that in part of Marathon County, I attend the department head meetings that Lance has every month because I'm just one of the department heads as it comes to it. So that's the important thing that we need to always look at and keep that in focus as we move forward. So, Vicki, I'll turn it over to you. You can just scroll up with the mouse.
Okay, hello everyone. I've been with North Central Healthcare for 7 months, so I'm going to teach you all about what I've learned about the community programs in just 7 hours. So I'm going to save you a lot of time. Just kidding. Everybody knows I'm kidding, right? I'm going to try to do this in like 15 minutes, so it's going to be a very high-level overview. Any of these slides, I could spend an hour on any of these slides. So you just know I'm really going to be touching the surface because what I've learned in my 7 months with North Central Healthcare is how important communication is and the lack of understanding of our community partners about what we do. And so I want to really make sure that the county board is very clear about what we do. As Gary alluded to, we are providing the community programs for Marathon, Lincoln, and Langlade County, but I'm going to focus on Marathon County tonight. And this is under Statute 5142, which literally defines the community programs that every county is required to provide for the state of Wisconsin, and we provide those on behalf of Marathon County. So those are required mental health and alcohol and other drug treatment for the counties, as well as crisis response. So crisis response for those that are having mental health issues as well as AODA concerns, and all the way up to inpatient care. You're going to see in my presentation that we provide a lot in between, as most human service departments do. However, I would say North Central Healthcare actually provides, with its really rich history and path that has been chosen by the county boards over time, that we provide a lot more services than most human services departments do. And that benefits us because we're able to obviously provide better services for people to help them in the community, but it's also more cost effective. The other statutes that we operate under are chapters 54 and 55, which are adult protective services, which is guardianship and protective placement. So I'm going to talk a little bit about high level all of those programs. Okay, I was going to tell somebody to go on. I guess it's me here. Okay. So our mandated programs at North Central Healthcare, first of all, what I want you to know, if you don't already, is that Marathon County is one of 10 counties in Wisconsin not operating as a human services department. So together with Lincoln and Langlade, we are 3 of 72 counties that are not human services. And so how that works for us in Marathon County is that with our partners at Social Services and North Central Healthcare, together we provide what is required for a human services department. So because we're not a human services department, our executive committee, which is comprised of members representing all 3 counties, have worked together to create a desired future state that you all have a laminated copy for your reference here. And this is really what is guiding us to bring our programs together. And it's a concerted effort to do so. And so I'm just going to do the highlights here, but basically it's talking about North Central Healthcare with our 3 counties working seamlessly together behind the scenes to provide the most vulnerable populations of our community with services, keeping them in the community whenever possible. And that's really important, as I mentioned, from a cost-effective standpoint, but also because that's what provides the best services for people, and it's really what they want us to do. So when we look at the community programs at North Central Healthcare, we have core services, and these are ones that we are providing to all of our partners counties, and I'm going to talk in a little more detail on each of these. Crisis response, outpatient therapy and psychiatry, community treatment, and adult protective services. And then we also have what I'm calling enhanced services, which is what most human services departments don't do across Wisconsin, which is inpatient care and crisis stabilization facilities. So we're unique in providing those cares. And soon to be opening is our 28-day residential treatment for people recovering from substance use. And we are just waiting for the Department of Health Services to give us the okay to move that forward. Otherwise, we are ready to go on that. Crisis services. So this is where it really starts. This is how most people get connected to our services. And it's governed under DHS 34, and then for those emergency detentions, it's under Chapter 51. And that emergency detention is when basically the decision is made by a crisis professional that the person is a serious danger to themselves or others, so that they need to be detained in order to be provided treatment. So that's involuntary at that point. Most of the people that we talk with and serve are voluntary, and they're seeking us for services, and that's through a 24-hour call center and walk-in. So on our campus, we have a crisis center that has the availability for anybody to come in and receive assistance. And also, again, our call line. And that is for support for those people who are struggling with mental health and or substance use issues. We do have mobile crisis response, which is primarily at the jail and at the hospital. We would like to expand that and be able to do more, and I'll talk a little bit towards the end about some of our barriers of expanding our crisis services, but most of our contacts are walk-in and phone assessments at this point. And at the end of the day, what our crisis professionals are always doing by statute, they need to hear from the person and understand what is the least restrictive measure of support or care that that person needs to ensure their safety. And they do that in a variety of ways. They see if somebody has a natural support system, if they already are receiving counseling services, if they would like to receive services through our agency, whether it's outpatient or community treatment, or any of the other things that we could offer. And again, then for those situations that are the most critical, we would be doing, looking at, that's where people would have the admission to the hospital. We also have in Marathon County specific, our Crisis Assessment Response Team, CART, which you, I'm sure, have all heard about and probably received some information about the success of that program. So this is 2 North Central Healthcare full-time equivalent crisis professionals working with our Wausau PD and Sheriff's Department, so paired with an officer to be able to respond to adults who are in some type of crisis. The goal there is to be able to help people in the community to stabilize them when they have mental health issues rather than arresting them, when that is not certainly the best path for someone, and be able to help them to get into services. So that's something that's been in our county for several years. We also have one full-time equivalent mental health therapist in the jail. That's something relatively unique for us as well. Okay, I'm going to move on then to our crisis stabilization facilities. So we have 2 facilities. One is for youth and one is for adults. They operate similarly. The difference is that the ages, of course, so the ones for the youth is for 17 and under. It is voluntary. Both are voluntary. And we can serve people that have either mental health or substance use needs. And for youth in particular, brief therapeutic interventions, which are when a family knows and a youth knows that there is a time in their month or in their life that's going to be especially difficult for them, and they tend to spiral down. And so instead of waiting for that to happen, be proactive and having a break for the youth where they can get some support and treatment to be able to have, again, that break from that situation. So those are very beneficial to youth and very much sought out by our social service partners and the community in general. And then the adult crisis stabilization is currently licensed for 8 beds, but we are transitioning to 16 beds as we have a greater demand. And we have a regional expansion grant that's a pretty significant grant to be able to help us to expand those beds to be able to serve more people in our 3 counties, but then also other counties that would contract with us because it is such a need. One of the things that sometimes people don't realize is that our adult crisis center can also be used for a step down after a hospitalization, or it can be used for an opportunity for people to maintain their sobriety in a safe situation, as well as a level of detox. I have to always be careful here when I say that because we are not a medical facility, and certainly in our crisis stabilization, we don't have that ability to provide that. So again, it depends on the level of the use that they have. And then we can move on to our hospital. So we have 24/7 service, obviously, for our hospital. For a youth hospital, it's 8 beds, age 13 to 17. And again, you're going to see the theme here for mental health or substance use, youth who are in crisis. And the key here is they're requiring inpatient care under the oversight of a psychiatrist. So the psychiatrist has to admit the youth to the unit, being able to verify that they have a diagnosis and that they would have a treatment plan that would be covered by insurance. I think that's a summary way to say how a youth would qualify, and the same thing with an adult to qualify for inpatient. Just to give you a scope number here, in 2022, 295 youth were served in the hospital, and out of those, that was 143 Marathon County youth. Through 623, we're basically on the same track. That looks like we'll have a similar year in terms of youth. With the adult hospital, it's 16 beds, so it's a larger unit. And we take both voluntary and involuntary on that unit. Again, those who could be detained. They receive psychiatric care, and again, probably a little bit of a higher level of detox can be possible at the hospital than at the crisis facility, but not the same level of detox you would get in a hospital. And so those are always the kind of distinguishing points, which are kind of hard to explain at different times. But at the end of the day, we are not a medical hospital, and somebody who truly is at a deep level of detox, that's a serious medical issue to be managed. So that has to be managed at a hospital before they can be transferred to us. So the other piece is medical clearance is required because we are not a primary hospital, and so people have to be cleared by a physician who can determine that they don't have other medical causes that would need to be treated, and we're able to treat what their issues are that they're presenting for. In 2022, we had 686 adults admitted to the hospital, and out of that, the vast majority, 516, were Marathon County. And then through 6/23, 299 adults. So just to kind of show the trend there. Okay, so then I want to talk a little bit about the numbers served in crisis, because this is a big number. Just through June 2023, 1,645 people utilized our crisis services, and that's through, again, the phone calls, the walk-in, inquiring about other services through our network in terms of being admitted to the hospital or crisis stabilization. Some of these people call repeatedly, and we're a check-in for them to be able to have some sense of support and stability so that they are not, can be stable and not having to have a higher level of care. And youth crisis stabilization stays in 2022. We had 169 for the whole year of 2022, and then the first quarter of 2023 there has been 84. Adult crisis stabilization stays in 2022, 272. So you can see that number, again, is relatively large. Okay, we'll move on then to our other area of business, which is outpatient services. So this would be what people would call counseling or therapy, but we also have psychiatry services. And we are able to treat for mental health as well as substance use disorders. We have individual therapy as well as group therapy, and psychiatric evaluation and medication management. I was asked this question previously at our Health and Human Services Committee, so I wanted to make sure to say this. While staffing is a challenge for us in many areas that I'm going to touch on at the end, the area that we are the strongest on is actually psychiatry and outpatient. We can still take external people, meaning individuals from our community who are not already receiving other services from North Central Healthcare, in order to do a psychiatric assessment and evaluation and follow up with medication. And that's a large part in due to our residency program that we have through the medical college. And the areas that we are struggling with more are mental health and AODA counseling. The AODA counseling in all of central Wisconsin, all of Wisconsin, and I don't know this is a fact, but I'm going to wager it's probably our whole country is really struggling with AODA therapy in general. So we're no different. That's one of the areas we are trying very hard to recruit in. We also have nursing support in our outpatient clinic. That helps with our different services, and then the intoxicated driver program that's required for the county to do, we do that. And as I mentioned, the resident psychiatry program, and they rotate through, our residents rotate through all of our programs, even our crisis center, our hospitals, as well as then our outpatient. So here's the individuals served in 2022, and I'll just kind of stick to the Wausau line. The outpatient mental health, 495. Now, some of those people might have come from Antigo or Merrill, but the vast majority are Marathon County citizens. Outpatient psychiatry, 1,533, and then substance use, 764. Okay, on to community treatment. So community treatment is basically what a lot of people will refer to as case management. So it is our case management that goes into the community to serve people. Our other services are on campus. This one is meant to be mobile. They see people, they're rarely in the office. And their job is to work with both youth and adults and support services to support people who are recovering from mental health challenges, as well as substance use, and help them to live independently as possible. This program is voluntary, and people design their own goals and their own service plan, and it's our case managers' jobs to help them reach those goals. Some people stay on one of our C programs. You have them all listed down here at the bottom. They have some similar components, and then some are different. Some are only for children, some are for adults. but they all have a case management function, and it really depends on the diagnosis that the person has in terms of which program is the best fit for them. So in providing all of those, again, they're community-based and they're voluntary. They have to, a physician for our comprehensive community service in particular, and our community support program, a physician has to provide information if the person needs that. And again, they need to be voluntary and participate in their plan. We serve lots of people, and I get this question often, is, what if somebody is homeless, or what if they are struggling with seeing you in your office, that type of thing. Some people love to come to North Central Healthcare and the community treatment, and they visit all the time. They like to be there, and that's like their safe place. And other people, we will find them where they are. That's what our job is for our case managers. So they see people, they've seen people in jail, they visit people wherever they are. Some of these people are on commitments and need to have injections in order to be stabilized with their medication. And our community treatment workers, along with our nurses, will go out and do that even in the community when it's appropriate. Okay, and here's our numbers served in community treatment, which again, I think is pretty significant. Marathon County, the adult team, and they are serving people that are have really quite persistent illnesses, 285. And then our Marathon County youth is 265. And the little asterisk there is noting that some of those youth are served by Marathon County Social Services, because we contract with them under our certification so that they could do service facilitation for some youth who have the highest acuity needs, so they can provide their comprehensive case management to those youth in hopes of keeping them in the community. Okay, Adult Protective Services. We provide this again for all 3 counties, and we do adult at-risk investigations that are required by statute for abuse, neglect, and financial exploitation. It's the target population is adults age 60 or over and have a physical or have a physical or mental condition that substantially impairs his or her ability to care for his or her needs. That's right out of the statute. And what our goal is and what our job is to provide a way for them to be successful in their long-term needs. And if they are judged to be incompetent, then that's when the court would be involved, and people may need a guardianship and a protective placement or protective services. At the end of the day, like all of our services, the statute's really clear that we have to provide services in the least restrictive manner. So we always have to be trying to serve people in the community whenever possible, giving them as much choice to their services and serving them voluntarily whenever possible. In 2022, just for scope of service, 683 investigations were completed, and we had 55 new protective placements. Lakeside Recovery, this is our MMT, medically monitored treatment unit, that's extremely popular with the community. When we had it several years ago, and we had to close it for several reasons. One was financial barriers, another one was program concerns, and then it was very close to the time of the pandemic as well. So as we're reopening, we learned a lot about what we need to do differently, and we're feeling confident that this time we will be able to provide that service even better than we had the last time. It is a 28-day program with 16 beds. It's voluntary, it's residential, it's not a hospital, it's not locked, but it will be on our campus. And again, our license is pending from the Department of Health Services. We're just waiting for them. Not so patiently, I was going to say patiently, but really not so patiently. We're really excited for them to come and do the site visit, because that's our last barrier to getting this open. And then we have our sober living programs, which again are really viewed as being necessary by our partners, and especially in our justice population. We have 2 locations, one in Wausau and one in Antigo. The Wausau one serves males, the Antigo one serves females. We do follow the apricity model, meaning that sobriety is required. Every person has a treatment plan. We don't provide treatment in the home, but everyone has a treatment plan that they must follow in order to be there, follow the rules of the homes, all those types of things. And then we have a case manager that works full-time with the people to help them reach those goals. and they have a lived experience lived experience house manager live with them. So somebody who has basically graduated from the program can stay there for a period of time and provide that leadership to the rest of the people. And it's a very, very successful model. On to our challenges. You heard me say this a couple of times, staffing. So I literally wrote it 3 times. Staffing, staffing, staffing. Our 24/7 programs are especially impacted with nursing. Psychiatric nursing is very much a specialty, and it takes a real special kind of person to want to dedicate their career to that. And then our behavioral health professionals, which are the people who are on the floor providing those cares. Those are the ones that we are really struggling with, and our recruitment is really in a critical point of needing to continue. We've made some progress, but really needing to continue to turn that around. Our crisis call center, and remember that's where I talked about, that's like the first place that people are going to come to access our services, and that's mandated that we're operating that 24/7. And that is, just a couple of months ago, they were at a 40% vacancy rate. And we've done some great hiring, and so the rate's a little bit better. I don't know exactly what it is. All those people are still in training, so they're not really in the rotation yet, but they're getting there, so we're making progress. But we really do need to, that's what we want to focus on, is getting our crisis center very much stabilized in terms of staffing, so we can look at some of those other expansion things that we're interested in doing. And then also therapists, which I had mentioned on a previous slide. Our safety and security, this is one of the issues that is a potential barrier for us taking a higher census and taking extremely complicated and behavioral challenged individuals, because we have safety concerns then for the patients as well as for our staff. So we have a plan in place, and we have improved our physical environment with our friends from our facilities and capital management in lots of different ways to make things physically safe in the building, as well as then we're doing some advanced training for de-escalation. And I just ask everywhere I go for people to grant us patience, because our new team has really only been in place for a few months, and we have really done a lot of evaluation of what needs to happen at North Central Healthcare to strengthen our foundation so that we can be the really strong, wonderful partner of human services that we want to be, and look forward to provide even more things for our partners as we gain that stabilization. My last slide here is our successes. Our partners are very happy. Law enforcement is thrilled with us that we've decreased our use of Winnebago for both youth and adult, because they need to transport, and that's a lot of time for them to do that back and forth. And obviously, Winnebago is not the best option for anyone financially or experientially. It's much better to serve people in the community. So using our own hospitals is always the best option. And then we've been admitting more complex individuals over time. And that has helped us, again, to be able to have all of our programs work together to decrease inpatient rates overall. And then in order to be as cost effective as we can, we're increasing the number of counties who use our facilities, our inpatient and crisis stabilization facilities, and we have contracts with numerous counties to be able to use those, so that helps us with our census, so that we're able to be more financially viable. So we have a plan on that, and again, making wonderful progress. We have lots of opportunities ahead of us, so really excited about this. We have on campus, with some of the remodeling that has been done, we have opportunities to be able to do either new or enhanced programs that will meet our desired future state that everybody wants to see. And that's what I've been doing really for the last 7 months, is listening to all our partners talk about what they want us to do and what they want us to help with really complex people. So we have no shortage of ideas, and the exciting part is we have some physical space to be able to do some of those expansions, and we also have the possibility, we'll see where things go, the possibility of being able to pilot some additional crisis services that may decrease our need to do emergency detentions and inpatient. So way more to come on that. That's talk that the Department of Health Services, Law Enforcement, and Human Services has been having for years, is trying to figure out a better way to do our whole crisis response system. So my last slide is just my information. I don't know if you want to take questions at this point before we go on to financial, or
Sure.
it's up to you.
Why don't we take questions on the community programs that are being run at North Central Healthcare? Any questions by the committee, by the board? Supervisor Marshall.
Thank you, Mr. Chair. Since it's been 3 years since we've had a lakeside recovery, who at DHS have we escalated to that we need this on site, like ASAP? Because we all know people who need those services. About a year ago, I had a coworker, and I did call the crisis line looking for a detox and program. The crisis line gave me 2 options, one in Green Bay and one in the Eau Claire area, of which nobody had beds. So when you're referring people, you're referring to places that they don't have services. So I guess my question is, who have we escalated this critical need for our community?
I appreciate the question. At this point, we are complying with everything that DHS is asking us to do and giving them all of the information. And just today, we got an email that we have a few more things that we need to give them. And so once we do that, they said we will be ready for a site visit. And so we hopefully won't have to have a need to escalate that. We'll see how long this takes, but I'm not going to give a timeline. See, I almost did it, but I'm not going to because it keeps changing. But yes, we understand the need that we have in the community, and with only 16 beds, we know that's going to be full very quickly. So we're going to need to figure out how to manage that as well, but thank you.
Supervisor Dickinson.
Thank you, Mr. Chair. So thank you for the presentation. So you mentioned you're looking to expand these services to a future state, that there's certain areas you want to focus on, right, to expand, I would assume, a level of service. It's not maybe a new statutory requirement. But then you also stated that staffing challenges, and you mentioned safety and security issues. I'm trying to understand how you can, what's the balance of doing both? Looking to expand, but yet where you are right now is a huge challenge.
That's exactly correct. That's exactly what I said. So I have a work plan that I have submitted to, of course, Gary as my supervisor and the executive committee that gets into a bit more detail of that. But you're exactly correct. We have to build our foundation before we expand. And so those things that I mentioned are what we are doing right now with the safety and security, the training, the staffing, and we have plans for every piece of it, and we're working on that. And what I want partners to let them know that we're listening to their request for expansion or enhancement, or like you're saying, doing a little bit more of something, not necessarily a new service. I just want people to know that they're being heard about that so that they know it's on our radar. But yes, timing-wise, we have to get that underneath us. We have to get that foundation before we can actually do that.
Supervisor Marash, please.
Thank you, Mr. Chair. I have several questions, and I appreciate your presentation and your patience with all the questions I had at the meeting the other day, too, so thank you. With your, the emergency, the crisis, the Chapter 51s, when you're taking people to Winnebago by emergency, how often is that happening now? And you mentioned it's much less, which is great, but do you have any data as far as cost savings so far?
I don't know if we've, Joanna, how often is it happening, and then money too?
Yes.
So I did not come prepared to be able to present to you on how many people we are having in out-of-county placements. I certainly can get that information. And overall, it certainly is less than if we looked several years ago. And I just know, like our budget, for example, the number 750,000 sticks out to me in terms of that we decreased our budget over the last couple of years by that amount of not having to pay those costs at Winnebago. And because really what happens is both we might have to pay the cost that's not covered by insurance, but also we're losing that revenue for our own hospital. So it's really a lose-lose. And from a patient care experience, I would say it is too. So we watch those numbers very closely, but I just didn't come with those, but I can get those for you.
Thank you. And then at the community partner campus, there was that area there for telehealth for, how is that going? Do you have any
That was actually up until the end of June, I think it was. It was a grant for a period of time. And we found, it was for psychiatry, and we found that there weren't many people who actually used it. So we gave it a try and just found out that it didn't work. There were just a couple of people, like less than 5, that used it for all the months that we had it going. So we're still active at the campus in terms of having a presence in the Human Services Suite and connect very much with the clinic there. But we haven't continued that service beyond the end of the grant.
Okay, thank you. And then with your adult youth behavior hospital and the adult youth stabilization, with your census numbers, which look like they're on track to be the same as last year, if it was fully staffed, would you say that it would be double, or what would that look like?
We haven't really done that analysis yet. We do want to do a cost-benefit analysis on if it was, if we could reach a higher census. And I'm going to just, thank you for asking that, because I don't know if it's ever realistic for us to say we'd have 16 people in the adult hospital, even though that's what we're licensed for, because people share rooms, and the acuity of patients sometimes are such that they can't share a room. So my goal is not really necessarily 16, but that's how the license works. But we do want it higher, there's no doubt about that. So one of the things that we have on our work plan is evaluating a plan for how many staff we need of each of the occupations in order to be at that highest level of staffing, and look at like that cost-benefit ratio. So we haven't done that quite yet.
Thank you.
And I apologize, I skipped over Supervisor Shafinsky next, please.
Thank you, Mr. Chair. Thank you for the presentation. A lot of detail there. And of course, as you stated, we could probably spend the next 7 hours digging into the infinite detail that's behind all of that. One of the things that you keep coming back to is staffing, staffing, and staffing. If you wanted to talk about I presume, maybe your biggest obstacle, that might be one of them.
Yes.
My question to you at this point, first question is, what level of staffing? How many people do you need? How many positions are you short? And what is the plan to actually get there, and in what time frame? You know, the answer of, well, we have a plan. We have a plan. A plan with no dates is not a plan to succeed. So what's the plan, and what are the dates that you have?
So again, I did not come prepared to talk about a plan tonight, so I don't have numbers with me, but I can tell you about the concepts that we're moving forward.
I don't care about the concept. That's not a plan. So if you can forward that information, that would be very, very much appreciated.
Okay.
The plan, the details, the target dates, that's what we need, because that gets you on track to actually start meeting your obligations financially to the county.
Yeah, and I do not want
That's
to...
the other issue that's weighing heavily on this board. So
Yes.
thank you.
Yes, and I don't want to mislead you when I say we do have a plan. I'm using the term concepts of what we're pursuing, but we do not have a plan by such and such a date we'll reach such and such vacancy rate, because that is very difficult for us to predict. I mean, we're at the mercy of when people are going to apply for a job and things like that. So we can do what we think is our best strategy to be able to get people. And I could just tell you a few things we're doing right now, but being more flexible with our shifts, for example. So instead of having 12-hour shifts for nurses or behavioral health professionals, we're offering 9-hour shifts to give some flexibility for that, and seeing if that brings us in more people. That's just like one small piece of it. So there's a number of things that we have in play. There's more we're actually going to be working with HR on very soon, next week actually, because we have some new ideas that we want to implement. So it is really various strategies that we're moving, and we're seeing what works.
So what I didn't hear is, how many people are you short? How many positions?
As I said, I didn't come prepared with those kind of numbers, because with your time shortage, I didn't know what you'd want to have more information on, but I can get that information.
Thank you.
Supervisor Robinson, please.
Thank you for the presentation. And NACO has identified the shortages of of workers is a critical issue across the nation. So it's not just something that we're facing in Marathon County or in Wisconsin. But I would like to just put in the plug for the expansion of the CART, the Crisis Assessment Response Team, which is a positive impact both on your crisis center and on the jail population in dealing with those individuals in the community and the importance of case management. But I would like to ask a question relative to the psychiatry residency program. How important is that in our ability to address the needs? Because I know at one time we had a significant shortage of psychiatrists in the community, and with that residency program, I haven't heard that recently. But how critical is that to your ability to address the needs?
We think it's very critical. We just actually did an evaluation of where the residents are, how they're being placed in their 4 years with us and the rotation that they're on. And they're able to do a lot that support our psychiatrists, and be able to see a lot of patients with supervision and oversight from our psychiatrists. But that just spreads the ability to be able to treat people. So it's very, very helpful to us. And then, of course, there's always the option of being able to recruit them to stay with us. So that's another thing we're always looking at, is trying to be competitive with that as well.
Yes, Supervisor Marshall.
Thank you, Mr. Chair. I just had a question on if community treatment is voluntary, when individuals that you believe need a case manager refuse community treatment, what do we do to keep them from generally ending up in jail?
Well, that's a very, very detailed, I don't even want to say broad question, but how I will answer it is, our community treatment workers are very skilled at engaging people. So it's not uncommon that the first time they would meet with somebody, they'll say, I'm not interested, or they might not say it that, in that way. They would just say, I'm not going to do this, right? So they'll meet with them several times, and they'll talk with them about what the advantages are and show them that they're kind of in charge of their own plan, and they really have a gift of engaging people. So first of all, that's what I would say. And even when we do have people, once they do have to sign a treatment plan with us, that's the requirement. But we have people who then, they're going through their illness, and there's times where they're not happy with us or happy with anyone, and they may say, I'm not going to do this anymore, right? Our case managers don't just go away. They will try again and figure something else out. So they're very, very dedicated to those they serve, and again, follow them all throughout the community. At the end of the day, there are some people that are not going to meet that level of dangerousness to self or others, and they're also not going to voluntarily accept service. So there is a segment of the population that there isn't an easy answer for, because people have free will to decide.
Thank you. And I should say may end up, not everyone who refuses ends up in, but I know that I've heard that from law enforcement that often that is the case.
Mr. Chair, if I can
Go ahead, please.
Thank you. I think that's a really poignant question, and that's an area where, again, when Gary started with kind of the senior leadership team's focus on knowledge of how counties function, the thing that Vicki alluded to, that idea of motivational interviewing, right? It's that someone, absolutely, it's voluntary, that program, but sometimes it takes how to ask the right question of, okay, well, Mr. Rosenberg, you don't want to come to treatment anymore or do anything. What do you think is going to happen with your probation agent? That follow-up question often leads people down a path of, oh, you know what? You're right, Vicki. I really should do that. And they are good. I think there's opportunities to continue to bolster that, but that's that interplay that you're talking about, Supervisor Marshall, when it's someone on probation. We do want to funnel them to CCS because there's programs and services that help them be more successful on probation or in drug court. Name the program. We want them to avail themselves of that, but it is voluntary. So it's this, I'll say, dance of how do we get people to do that? Because by law, it is that voluntary piece. But at the same time, a very skilled CCS worker, and you'll hear more about some of the SEAT programs that Vicki talked about later, is really very important in that. But by no means is it perfect. Sometimes people exercise that free will, and it just doesn't work out well for them or us.
Okay, any other questions for Vicki? Supervisor Sarver, please.
Thank you. I'm just going to pick one of these departments. Let's pick the inpatient unit, where the youth served 295, the adults 686. How many days was a bed taken through the course of a year? Like in the 16 days, there's 5,800 days. In the 8 unit, there's 2,900 days. How many days was somebody in that bed? And that or what percent are we at of being full?
Well, I can tell you the average length of stay in the adult hospital is probably 3 to 5 days, and in the youth hospital, it's probably a little bit more, probably more around 5 days, sometimes up to 7. So that would be what I would say to you, just in terms of an average. Our census is, it varies, it's different every single day. So for me to tell you what it is today won't necessarily matter tomorrow because people are being discharged and inpatient. So we have to kind of look at our long term, and that is what we're working on, is increasing our census. So I will tell you we are not where we want to be. We definitely have room for expansion. I shouldn't say expansion, we have room to build that census and have to have those things in place that we talked about. And we're working on it, we're making progress.
Thank you.
Okay, any other questions for Vicki? Okay, then we'll move on. Thank you, Vicki, and we'll go on to the Finance Director, Jason Haig, please.
Great, thank you. My name is Jason, and like Vicki, I'm fairly new to North Central Healthcare. I've been there about 6 months, but as Gary said, I have experience in county government and finance and administration, so coming in, the programs and services offered here were not new to me, so that certainly helped. Before I jump into the finances of community programs, I just want to give a quick overview of the size of our organization. So as you can see, our 2024 draft budget is about $87 million. So if you look at the pie chart on the left, our total revenue, you can see our net patient revenue is about $60 million. Our other revenue is about $20 million. And then our county appropriations or tax levy is about $6.6 million. And that's the total appropriations that we receive from all 3 counties. If you look, move over to our total expenses, you can see our salary and benefits make up the majority of our expenditures. We're at about $59 million there, which is about 67% of our budget. So in total, in 2024, we're budgeting for about 612 total FTEs. So community programs, like I said, I have experience in county government, and just in my opinion, when it comes to county financials, I think that community programs is the most challenging budget and financials in all of county government. And that's just because we have so many various different funding sources, tracking that we have to do, splitting of expenditures, and I'll get more into that a little bit later. And then on top of that, at North Central Healthcare, we have the inpatient units, which is unique to county government. So just another layer of complexity. So if we look at our total revenue for 2024, you can see that we're at about $43 million in the community programs budget. Our total expenses are about $35 million. So it looks like we have a surplus, but I can assure you that we are not making money. I really wish that was all profit, but I can assure you that's not the case. So we are county government, and as you know, county government does not make money. So what this is doing or showing is it's covering our indirect costs that we have within our organization and the indirect costs that are required to provide these services. So our indirect costs are really the costs that are necessary to perform our services but are not identified with a particular program, service, grant, or funding source. So some examples of these would be like our HR department, safety and security, quality and compliance, accounting, purchasing, housekeeping, IT, et cetera. So if we look at the revenue pie chart, you can see that our net patient revenue is about $29 million. That's the majority of our expenses, and that I'll get into what that specifically is later. But it's really what we're billing for services. Next, we've got our other revenue. That's about $9.2 million, and then our county appropriations of $4.7 million. If we look at our total expenses, $35 million. Again, salary and benefits making up the majority of that. Makes up about 69% of our expenses. And then the remaining $11 million are other expenses that we have, and I'll outline those later on. So I talked about the complexity of community programs budgets, and you can see that our net patient service revenue, like I said, $29 million. This is where we're billing our fee-for-service revenue. So we're billing Medicaid, Medicare, commercial insurance, and then we got specific programs that we're billing, which could be our CCS or community services, community support services, or CSP, children's long-term support services, CLTS. So all those C programs that Vicki just talked about, each one of those has a funding source that we need to bill. That could be insurance, it could be specifically to that program. So that's where that complexity starts to happen. Then we need to make sure that what we're billing is also aligning with our expenses, because you got to be able to justify the revenue that you're billing. Let's see. So then, additionally, like I mentioned, we do have the inpatient hospital, which is unique. And then the other complexity with that is we now have to start breaking out our revenue and expenses for any of the placements that we take for other counties. So that could be our tri-county, but we do take placements from outside counties as well. Vicki mentioned we were starting to get additional contracts in place for that. So we need to break those revenue and expenses out as well. So I think last year we had about 20 placements from other counties. So we then need to break out those revenue and expenses out amongst all of those counties as well. So it gets to be pretty complex when you start diving into the details. The next category that we had was our other revenue. That's about $9 million. So that's really just the various grants that we receive throughout the organization. That gets challenging because within these C programs, you also have grants that you can apply revenue and expenditures to. So I won't get into the details, but it gets to be a little bit complex. And then, like any grant reporting, we need to make sure that we know what expenses are eligible to apply for these grants. We need to be aware. We need to be aware of that. And then most of these have annual financial reports that we need to do, cost reports, annual rate settings, and then we need to align all of that with our programmatic reports that are usually due. So there's a lot of collaboration between the finance side of things and then our program side as well. All right, so expense overview. So as I mentioned on the last slide, that layer of complexity and needing our expenses to align with our revenues. Our expenses should align with the program, service, location that we're billing. It sounds like it should be easy, right? But it's really not. So as a reminder, our salary and benefits make up about 69% of our expenses. And we've got around roughly 259 FTEs within community programs. So each of those FTEs needs to be broken out by the program, location, the service that they're performing, and then that allows us to bill appropriately. But that means we need to break out the expenses for 259 FTEs. So one employee could be charged to one department, another one could be charged up to as many as, I think we have like 11 different programs, services, locations between Lincoln, Langlade, and Marathon counties. So it gets to be a little bit, like I said, a little complex. Now the real challenge comes in with this is with our payroll software not talking to our billing software. And that's just, that would be too easy if it did that. So it's really just due to the complexity of our organization. We're very large. We've got 3 counties. We provide inpatient. We provide the community program side of things. So there's no just out-of-the-box software that you can purchase that does all of that. So it's very manual, which creates a little room for error. But luckily, we've got a really good accounting team in place. In 2022, we had a clean audit with no audit findings. So we're doing a very good job of tracking, breaking out, and billing on the finance side of things. Our other direct expenses, that is about $11 million. So that's contracted services. So we do contract with a lot of providers in the community to provide services. We can't provide all of it. Many of those are through our CCS program, which is 100% funded. So that could be anywhere from like therapy, medication management, individual skill development, whatever services are allowable under that program. So that's really just a quick overview of the community programs, revenue and expenses. And just as a reminder, it's about half of our overall budget. So it's a very large portion of North Central's budget. So as many of you are probably aware, there's been a lot of construction going on at North Central over the last couple of years. And now it's time for us to start servicing that debt. So I'm not going to lie, that's going to be a challenge. It's not going to be an easy task. The reason why is partially to what I mentioned earlier. We're not really in the business of making money. We are county government. Government doesn't make money. So, as Vicki mentioned, we're providing services to our most vulnerable population, with Medicaid being our largest payer source, which is usually one of the lower payer sources. With that said, in 2024, our obligation for the debt service is $2 million. So if we move down on this table, you can see Mount View's portion of that is just under $1.1 million. So we have that debt payment included in the Mount View Care Center budget for 2024. If we look at the next line, the increase in CCS revenue, this is a really good example of how we understand how county government works. And what we did here is social services provide CCS services, and we were paying them at a lower rate than what it was costing them to do or to provide that service. That is 100% reimbursed through the CCS program. So starting July 1st of this year, we increased their rates so that they would be fully compensated for this program, and then we will get fully reimbursed through the CCS program. The $300,000 represents the savings that will save social services next year in tax levy, which then we are requesting that gets shifted over to North Central Healthcare. So then what we started to do is we looked at other services that we're providing, and we found that we've been providing services the last several years to Marathon County that were not funded. And typically when we provide services that are specific to one county and not the other two, that county pays for those services. So we've been able to provide the crisis professional, or CART, 2 FTEs, mental health therapist in the jail, 1.0 FTE. We have the MMT that's going to be opening up next year. So we provide services to a lot of justice system users. So that's the $160,000 is the offset of uninsured costs to continue to do that. And then we have the Hope House or Sober Living House. So these are services we've identified that we've been able to do for a very long time without requesting additional tax levy, but we're getting to that point where that's just not sustainable anymore, and especially adding on that $2 million debt payment that we have to make next year. So this table is our 2024 county appropriation or county tax levy. What it shows is we've got the programs listed on the left-hand side, and then it breaks it down between the 3 counties and the total. So you can see the total tax levy that we're requesting for 2024 is $5.8 million from Marathon County. And our total tax levy between the 3 counties is the $6.6 million. So this table shows the historic county appropriations broken down by each individual county. And you can see the change from 2023 to 2024, $631,000. The next slide will go into detail of what makes that up. But I do want to just point out that from 2014 to 2016, we were as high as $7.8 million in tax levy, and that has decreased to a proposed number of 5.8 in 2024. And some of that was due to services that or Central provided that were moved over to the county, which was facilities. I believe that was done in 19. Either 2017 or 19. So if the expense shifts over to the county, the levy shifts over. Makes sense. But I think this shows that the tax levy over the years has decreased, and we've been able to do that while continuing to provide those additional services that were not funded. So this is the change from the prior year. You can see that the top line, we requested a 3% tax levy increase from the 3 counties. We decreased our tax levy by $440,000 from Pinecrest. We're unsure if Lincoln County is going to continue to operate Pinecrest next year, so to be conservative, we did remove them from our budget altogether in 2024. And then we have $904,000 from Marathon County for additional services that we've been providing that previously were not funded. So that gets us to that total change of $631,000. So with that, I can take questions.
Questions for Jason? Supervisor Dickinson.
Thank you, Mr. Chair. So a question about billing. So I have a couple here. So do you bill for all services? Meaning, do you have any write-offs for any charges not billed? Or do you apply, in that case, do you apply some other dollars to zero out the budget in that case? Do you see where I'm going with that? I know there's a requirement that if you don't bill for a service after a year, you would write that off because you can't bill after a year. So do we have any of that going on?
Yeah, we have a small amount of administrative write-offs. Sometimes, insurance might not cover it, so we're writing it off. Sometimes we have, we can't bill insurance. Somebody might not have insurance. Of course, at that point, we try to get them signed up for insurance, but there could be a time period where they might not have it, but they need it to receive services. So what we do is we do receive some grants for that. Some of that we classify as charity care, and then those grants will cover some of those expenditures or write-offs.
Okay. So there are some times when you didn't bill for a service that you provided.
Yeah, I mean we very rarely would not bill for a service.
Okay.
It would be more the fact that it's not covered or there was something wrong with the billing.
So then in that context, then when you do bill for a service, you're saying that we don't get 100% back from insurance company or something, so there is some time where we have to take money from a grant or some other place to make up that dollar amount, and so then It's a zero out of the budget. You're zeroing it out, is that
Sure,
correct?
yeah.
Is any of that tax levy money?
Defining where the tax levy goes it's a little complex because, grants can be used for many different expenditures. And, I think it's important to look at tax levy as a whole than it is an individual, program. So, I can't say exactly what that would go for. The tax levy kind of goes towards the bottom line of providing a certain service. Yeah.
Supervisor Marshall.
Thank you, Mr. Chair. I did see that aquatic services was billed only to Marathon County. Is there a reason for that? Because I know that there's people from all counties who use that service.
Yeah, that was a specific service that Marathon County runs here. If somebody from another county uses it, we'll bill their insurance. But it's a specific service that's located here that was funded and started by the county.
But while it's located here, everyone from Vilas County down to Marathon County uses that service. So shouldn't other counties contribute to that $350,000 shortfall? And then my other question is there any effort to lift the requirement to have a doctor's note to use that facility so that you get more usage and then it wouldn't be a tax levy?
Yeah, a lot of the usage in that in the aquatics area is from the nursing home. I don't know if I can really speak to the history of the pool. I don't know if you want to take that one.
Yeah.
Administrator
I
Leonard.
know John is Supervisor Robinson can answer that. It is to your point, your question, Supervisor Marshall, the county appropriation page, and if you look at the annual North Central budget over the last several years, you'll see things categorized in terms of direct and shared services. And essentially, it's broken down the way Jason said. It's what county desires the service. So Hope House is classified as a direct service for Marathon County because we have historically wanted that. It's not a service that exists in Lincoln County. Certainly Lincoln County residents, if there's space, could utilize it. I don't know if there's a prohibition on that. I'd turn to Vicki, but it's the county's decision what level of services you want. That kind of has led to the aquatic therapy services being a Marathon County service. I think for those of the members that were on the board a number of years ago, I think it was made abundantly clear that aquatic therapy was not a mandated service through the state of Wisconsin. And the county made the investment. After the community raised $3.4 million, the county put in $3 million to build that new pool. The hope is, of course, that runs and is cost neutral. I'll say that one of the things that working with this group that is, again, they understand county government, the opportunity to bring in any additional revenue, they're very open to that. I see Jamie's in the back. We have, in times of that staffing program by physical therapists, our Parks Department now is using it at sometimes to do things like young child swimming lessons to take advantage of the warm water. So they're working on it. That was a long answer to your question about, is it, at the end of the day, it was a Marathon County decision that the board made a number of years ago to operate that pool. Our hope and intent is, similar to what Vicki talked about with community programs, is to drive that utilization in such a way that it pays for itself. And that's why, again, they're working, I'll just say, working with this group, they're doing a good job. They're trying. There's a lot of stuff. When Vicki's talking about staffing, if you pulled open the local city pages today, you saw the front headline article about staffing in the jail. There are I sent a report a number of weeks ago to, I believe it was members of the HR Finance and Property Committee, on a report from the Wisconsin Policy Forum talking about churn within the state of Wisconsin workforce and the 3 hardest areas in which to recruit and retain. I should say retain and recruit. They are corrections, nursing home, and behavioral health. Congratulations, we have those three things. As Vicki said, a lot of it's the 24/7 component. I mean, each of those is. It's a different world than it was when the master plan was put in place. But I will say, I think Jason, Vicki, and Gary are doing all they can. We are meeting very frequently. The last time I was down there, they had rough news. A lot of this that you saw was news they delivered to me. They had the common decency to offer me a cookie, much like Supervisor Marash brings to you sometimes. I mean, we have a really good working relationship. We are searching for all those things. Credit to Gary and Jason on the financial side. That $300,000, that's great. They went out and looked at where are opportunities to find revenue for, and that's benefiting the county. That's going to social services. The relationship we have to try to improve, to Gail, Supervisor Marshall's questions about the jail, there are going to be a lot of things that North Central can do to help the larger county bottom line. And having these three people that really understand the county business is going to help us do that better. So very long answer. I know that the information you're seeing, I mean, Jason's saying it nicely, that servicing the debt is going to be hard. There's a lot of things that are headwinds on that were not anticipated 4 years ago. Pinecrest potentially being sold was certainly not anticipated. The dramatic change from the state of Wisconsin on supplemental payments and CPE payments for nursing homes, certainly not anticipated. The staffing changes with CNAs, a lot of those headwinds were not anticipated. They're doing a really good job to do their best to head them off. But it's going to take, as Vicki said, it's going to take some time. Sorry, that was much longer than you needed.
Supervisor Sandalski.
Oh, thank you, Chairman. I'm just looking at page 30 there to figure in, like per county. Can you explain how that's figured per county, how much they contribute? Because I was just looking at like Lincoln County, they dropped down like 400 some thousand, and Marathon's up like 1.1, somewhere around there, little over $1 million. And Langlade's pretty, the last one, well, like if you look through 2020 through, they're kind of similar, but then in 24 it changes, those two change quite a bit. I was just curious as how that's figured out.
Yep, so if you go to the next slide, it shows the change from 2023 to 2024. So part of that increase is the 3% tax levy increase. You mentioned Pinecrest, that decrease, or Lincoln County, that decreased $440,000 from Pinecrest. That's their nursing home. They're looking at selling that nursing home. So we removed Pinecrest from our budget altogether in 2024. The reason why is that's the conservative approach, because Pinecrest does cover some indirect costs. By removing that, we then have to find a way to cover those costs in 2024. If it stays, well, then it's going to help us financially. But we wanted to make those hard decisions now. And then Marathon County, you can see the $904,000 for the additional services that I mentioned were not previously covered, and then that CCS revenue. If you look back historically, there are some changes. Like in 2022, you can see Langley jumped up $20,000. That is due to the sober living house that they started up. So that's a specific program for Langley County, and then they funded that with that additional $20,000. If we go back further than that, I know one of the big years, either 19 or 17, was due to the facilities change, moving over from North Central Healthcare to Marathon County. But I would have to go back and research what those other changes are specifically. I don't have that offhand.
Just to add on that, you'll see when Jason talked about Pinecrest, if you look at 2019 to 2020 for Lincoln County, the reason it went up by $328,000 is because that's the year that North Central Healthcare took on the obligation to run Pinecrest. So North Central does the statutory mandated work that Vicki talked about, the community programs. But for Marathon County, for a great many years, they have operated your nursing home. The county does not have to operate a nursing home. Again, for members that have been on the board for a while, you know that all too well. You studied it extensively, and in 2017, 2018, made the decision to stay in the nursing home business. You have a nursing home operations agreement between Marathon County and North Central Healthcare. North Central runs that nursing home. So if you read the Wisconsin Counties magazine, the recent one that was put out, the first 15 pages talked about counties and some of the challenges with running county-run nursing homes, but nevertheless how they're really important. So you'll see that there's levy that goes into running a county nursing home. Marathon County has put levy into it. Lincoln County has historically put levy into it starting in 2020 because that's when that agreement was signed. Now, Lincoln County, if you have tea leaves and you like to read them, perhaps you're better than I, but all indications are that Lincoln County is looking to sell that nursing home. That's why Jason, Gary, and Vicki built that budget to have that removed. And much like the community programs discussion where Jason talked about indirect costs, the same thing happens for nursing homes. You know, if you think about it like you run a business, right? Your indirect costs to go from a business with, you know, when you're small, you're the HR department, you're the legal department, your administration, you're all those things. Once you get a certain size, you probably add an HR professional, maybe a finance professional, and that holds you for that you don't need to add those professionals every time you add 1 or 2 additional staff. It's a scaled approach. So when North Central took on Pinecrest, it was an advantageous relationship for both because North Central was able to do that without adding much staff. They took on a whole nother nursing home in terms of nursing home administration, HR, legal, all that stuff didn't grow substantially. But the nice thing is what it did, it allowed those indirect costs to be spread out over Pinecrest. So with that going away, as Jason alluded to, that makes the budget more challenging. Just like the state's change on its supplemental payments and CPE payments, that's why Health and Human Services is advocating for Marathon County specifically to kind of be active in trying to get the state to revisit that.
Supervisor Baker.
Thank you, Chair Gibbs. So just to make sure that I understand the situation correctly, and I will be brief. So originally, the debt was scheduled, North Central was scheduled to cover $4+ million in debt. That was negotiated down to $2 million for this year, for next year. And the proposal is that we'll raise taxes 1.04 million or 904,000, depending which way you look at it, to cover about half of that $2 million. Is that a good, legitimate summary? Thank you.
Well, I can speak from our viewpoint. We're requesting an additional $904,000 of tax levy from Marathon County for the services that were provided and we have been providing that haven't been funded. Lance, I don't know if you want to speak from the county perspective.
Sure.
I think there's one other change, though, and that is there's a $300,000 increase coming into social services that is being billed for that isn't currently. So, to change that, Supervisor Baker, instead of the 900 and some thousand, I would say it's 600 and some thousand. But I don't know that we're going to effectively raise all taxes to do that. But the funding request increases 300,000 or 600,000. 300 of it's coming from increased revenue that the Social Services Department is receiving from funding that they're billing for from the state. Supervisor Robinson.
First of all, a comment and a question. Supervisor Marshall, the physician's referrals are required to access the physical therapist services in the pool, and that's for reimbursement purposes. And if without that physician's referral, they can't pay for the actual physical therapist service unless there's a self-pay provision. There is a community where people can pay to access the pool and on a daily or monthly or annual basis to access it. And I'll be happy to talk to you afterward about that. But it's called Community Swim and other things. But people are able to do it. But that requirement is a requirement of the insurers and Medicaid and other reimbursement systems. Most physicians in the area will prescribe that there are limits on how many visits they can have, typically depending upon the insurance company or program that they're in, but there is coverage. I do have a question then, and it relates to the Mount View component, which we really haven't gotten into. We have the supplemental aid program, and I know you've talked to some of the committees, but where are we relative to the supplemental aid from the state of Wisconsin, both for this year and future years?
We're still in a holding pattern on that because we're waiting to see what happens with the state. We have tried, and I know your Human Services Committee has asked us to put together a group, which Lance and I will be working on getting that together so that we can get the members of the legislature there. Representative Callahan is on the Lincoln County Board. He discussed it a little bit at Tuesday's meeting on how they had tried to get that through as a budget amendment, and it didn't pass. Right now, really, DHS needs to look at that formula. We've said that, and we don't know where that's at. It's not just Marathon and Lincoln County that's impacted by that. 16 counties are impacted by that change. So right now, I don't have a good answer for you on that. We're still working on it, but we're hoping, and it's not going to be until December, really, when we see the new numbers come out for the supplemental to find out how DHS is going to relook at that formula, if they do relook at that formula.
If we receive the supplemental aid, will a need for a county increase for Mount View go down?
If we could get that money back, because this is the one thing that, so they just increased the Medicaid rates again effective July 1st. Just like last year when I did the budget, we had anticipated that supplemental payment being there, and then they took it away in December. We don't know what's going to happen with the supplemental payment with that increase, so I don't believe we budgeted for any, increase with that. So if they go back to the old formula, like they did with supplemental, and we would see that because it's $39.1 million, as long as the state still gets that, if that's spread out the way it used to, we're going to see a lot more revenue in the budget than we anticipated. That would totally change things, but that, I can't read the tea leaves, as Lance mentioned, on what's going to happen with the state. But if we can get that back to the way it was, it very much so changes the nursing home money coming in. That would be a huge game changer. So if we had that money this year, it would be much different too on our bottom line.
I do just want to clarify that we're not requesting a levy increase for Mount View.
Right.
That if you go to page 28, you'll see that Mount View just shy of $1.1 million. We're covering that portion of that. That's their portion of the $2 million of their debt. We're covering that in their current 2024 budget without any levy, additional levy being allocated to Mount View or requested.
Supervisor Marash.
Thank you, Mr. Chair. So mentioning that Lincoln County might sell Pinecrest, what is our contract with North Central and Mount View? How long are we in a contract for North Central to run Mount View?
there is no end date to that contract, and I certainly don't want to take over running a nursing home if I,
Well, I'm just curious if we'd ever wanted to sell it, if we would be able to sell it.
short answer, yes. I think you can, as anyone in your private life, you can sell virtually anything. The question is always, what are you going to get for it? You built a brand-new building that is intimately intertwined with the rest of the campus based on the direction from the board a number of years ago. It would be a very difficult prospect to split that up and figure out how to do it. I hesitate to say, stuff is always possible, right? Anything's possible, but it would be very, very difficult, and to get the money out of what you owe on it, because as Jason said, right now they are servicing the debt as planned. There absolutely is a tax levy component to it right now, but short answer to your question, there's no time limit as far as I recall from reading the agreement, and you certainly can sell. The question, and I kick it over to Supervisor Robinson, I believe he served as the chair of the committee that looked at this. The county does have a mandated obligation relative to protective placements that the nursing home does play a role in and can play a role in mitigating those other costs that you would incur if you had to pay for those individuals to be elsewhere. So there is a benefit and a corresponding, if you weren't in the business, there'd be a cost to not being in the nursing home business. I know that's not a very helpful answer, but again, if Supervisor Robinson has anything to add, I know I was tangentially involved in that nursing home committee, but running a nursing home is a complex thing. As Gary said, there are a significant number of counties that do. There are some counties that have multiple nursing homes. We've had that Mountain View agreement. I want to say it was signed in the 70s, but I'm not sure if that's accurate.
So when the Nursing Home Operations Committee or the Nursing Home Task Force looked at the operations, one of the things they did study out was what is the cost for the protective placements that the county would be responsible for if we had sold or did not stay in the business of the nursing home. And the number, as I recall it, was the number that the county would have to pay other counties or other nursing homes for those protectively placed individuals exceeded the tax levy that was being supplemented in the nursing home. And it was also anticipated, as it is currently even budgeted, that the nursing home, the new nursing home structure, would be able to finance the nursing home portion of the debt. But that, again, that was in 2017 when it was looked at, but I would have to look at those numbers again. Gary, please.
One more thing I'll add with the nursing home. Your nursing home is one of 8 in the state that has a vent unit. So our vent unit it's one of the top-notch units in the state and one of the very few that there are out there. So it's a very good facility, and the state recognizes the need for vent units a little bit more. They did increase the rates starting July 1st for the vent unit also. So those rates have been increased.
Okay, Supervisor Stravinsky.
Thank you, Chair. So my question would be relative to Mount View, and we kind of keep circling on this, that it's a challenge for the county to be running the nursing home. I guess the first question would be, what is the census? Where are we in terms of capacity at this point? Are we 50%? Are we 90% full? Do we have a number on that?
Well, as of today, we're at about 112 for census. That has decreased a little bit with some individuals passing away, but that does ebb and flow a lot. So last month we were about 120. So our budget for 2023 and 2024 is 128. Once the construction is complete towards the end of November, we could go as high as 160. But to To Vicky's slide, staffing, that's the challenge that we're facing right now. We have seen some really good recruitment as of late and some really good numbers as far as onboarding. But that's still a challenge. So we are doing some some analysis on, does it make sense to look at contracted agency staff, because we haven't gone down that route. What's that balance of, should we do that compared to the revenue that we'd be bringing in? So we're looking at all avenues, but right now the staffing piece is our largest obstacle.
Okay, thank you very much for that. I guess at the end of the day, and I understand this is a very simplistic question to a very much more complex financial question, but at the end of the day, can we put a number on where we are in terms of running the nursing home? Are we, do we break even? Are we in a hole? If so, how deep a hole? Can you provide some guidance to that?
Yeah, well, this year we have net income. I don't know what it is off the top of my head. I think it was around $700,000. Now next year we've got that debt payment portion to pay. So, that's going to eat up that net income. What we have seen over the last 2 years is some pretty significant increases in Medicaid rates. Last year we saw a 47% increase. This year we're waiting to get the final number, but it's looking to be about 27%. So with those increases, and if we wouldn't have seen the reduction in that supplemental payment, we'd be doing very well. But losing $1 million in the supplemental payment is certainly been a challenge for us to overcome.
I think one of the things that you look at with the nursing home also is that helps cover your indirect costs, some of your indirect costs for community programs. Because we're able to take, as we discussed with losing Pinecrest last year when I did the budget, and I had no idea really where they were going with Pinecrest because we did the budget and it started that committee, but we didn't know where they were going. Well, having the nursing home also helps with your indirect costs for your community programs, and that's all your overhead costs that you have that are not quite all for the program. It's like the accounting, the administration, HR, anything like that you have helps cover that also. So that's all built in there and helps spread that out. So without the nursing home, then that would drive up the costs of community programs.
The other thing that is pertinent to determining the financial viability of the nursing home is the payer mix. Whom is the payer for the individual in the nursing home, whether they're private pay, whether they're Medicare, whether they're Medicaid. So each one of those payers have a different level of pay that they provide for the same service.
Thank you. Very informative.
Supervisor Langenhahn, please.
Thank you, Mr. Chair, and I want to thank the NCHC leadership team for coming out and presenting to the board tonight and taking the time to answer some of our questions. One thing that I wanted to note, and it's been a theme for at least a handful of questions in the past 10 minutes, and I don't know who has the answer to this, but how do we get those supplemental payments back? Because if our budget forecasting all those years ago included that as an assumption, wouldn't it stand to reason that we could improve our situation as a county pretty dramatically if we were to get those supplemental payments back? So who made the decision to take them away, and how do we talk with them to convince them to get them back? Thank you, Mr. Chair.
Well, we are trying to set up a meeting with the legislators to talk to them. The decision solely came from the Department of Human Services, DHS, and the way that they do the formula. So, go.
Finish what you were saying.
No, and I was just gonna, that was pretty much it, that it would be DHS looking at that formula again, because it's a long story. We've been talking for a long time. I could bore you forever with the supplemental payment story, but unfortunately, it benefited 2 counties. Dane was one of them, so.
Supervisor Langenhahn, follow up, please.
So then, what can we as a county do to help North Central Healthcare out? Thank you. With those supplemental payments. Thank you.
If I can start, Mr.
Go ahead,
Chair, and
Lance,
then
please.
Anybody else can certainly add on. One thing you did attempt to do, and Gary alluded to this before, it's how do you interact with the legislature to try to, and other elected officials at the state to get that to happen. This body did approve a resolution which was forwarded to our local and state elected officials, asking them to restore that, essentially that loss of funds that Marathon County incurred. Like Gary said, there were 2 counties were impacted positively, the rest took a hit. And Marathon, and as well as Lincoln, took a pretty substantial hit. Between the two, it was just about a $2 million hit collectively, is my recollection. So one thing is certainly resolutions. I think individual conversations with local legislators. I know Gary's had those. I have. I know Chair Gibbs has, based on our role on the North Central Healthcare Executive Committee and North Central Healthcare Board. The North Central Healthcare Board sent a similar resolution to those local elected officials, as did the Lincoln County Board. But it is right now, it's an administrative, my understanding is consistent with Gary's. It's an administrative formula that was adopted. The explanation that I've received, and I don't know that it's accurate, but it had to do with operating losses sustained by a couple of counties. But I don't know if that's accurate. I don't know, Gary, if you have other thoughts.
It's a complicated formula, but so all of the county-run nursing homes, all of them, have band together with the exception of Dane County to ask that the formula be looked at differently and brought back. Of course, Dane County didn't. They got $7 million, so of course they wouldn't want to look at it differently.
Supervisor Langenhahn, go ahead.
Third and final follow-up. Thank you. It appears that we didn't make enough noise then. So what else can we do? And I find it hard to believe that the state of Wisconsin doesn't have the money to make us whole, because they had a $7 billion surplus, and I think they still have money left over. Thank you, Mr. Chair.
That was highlighted in the resolution that we sent to them, and as explained earlier also, Representative Callahan from the Assembly did offer an amendment to the budget to bring those payments and make the 16 counties that did receive a decrease whole, but that fell short at the Finance Committee. Supervisor Robinson.
Thank you, Chair. Just picking up on the last topic, it's incumbent on us to engage both the Department of Health Services and the Governor's Office in that discussion, as well as the legislators, because that's really where the administrative decision will be made unless it's subject to a 1310 review. So we should do that. But I just wanted to go back to the questions relative to the nursing home. And the issue of protective placements was something that we looked at in the nursing home study group. And we were averaging at that time about 62 protective placements a year. And basically we have the financial responsibility if they lack the means to pay for those individuals. And when you start looking at a few $1,000s a month, that the county subsidy will be absorbed through the placement of people elsewhere if you can find the location. And I think that what you're seeing in Wisconsin is at one time we had the most nursing homes per capita in the country. Those beds have been closing because of reimbursement and the Medicaid program not paying its fair share. That's been changed, but there's a shortage of beds all over the state, and more facilities, private facilities, are closing down. So we would be faced with a situation where if we didn't own it and the new owners didn't take on the protective placements, we could be looking at a significant increase in cost for those individuals.
Supervisor Carvelli.
Thank you, Mr. Chair. Supervisor Langenhahn asked what we could do further to help, have them take another look at those supplemental payments. My suggestion, when I brought it up at the Health and Human Services Committee, is to contact our legislatures. is we can all together contact them separately. When they hear from 38 members of a county board separately, they might take a closer look at that. So that's my suggestion.
Okay, Supervisor Dickinson.
Thank you, Mr. Chair. Just a comment, and don't take this the wrong way, but you made a comment before that, government's not in the business of making money. However, you have a debt service that someone has to pick up $2 million a year or $4 million a year. So I know you know this. I know you understand the serious nature of being able to find that money so that each and every year going forward, it's not going to fall back on Marathon County.
Yeah, that's our goal. I mean, we will try as hard as we can, but, $4 million is a lot of money to find.
Okay, any other questions? Okay, any closing comments, Gary?
I think we've used up our time. I want to thank all of you for listening to us. I can't say enough thank you, and just know that we're here to serve you and the most vulnerable population that we have. And we know that we are Marathon County, so we're here for you and as part of you. So thank you, everyone.
Well, thank you, Gary, Jason, and Vicki for that presentation. We'll move on to review and discussion of Tuesday meeting agenda items, and we'll start with item 9A1, North Central Wisconsin Regional Planning, Regional Planning Commission appointment.
Reappointing Supervisor Dave Oberbeck of Wausau to the North Central Wisconsin Regional Planning Commission to complete an unexpired term to conclude in April of 2024.
Any questions on that appointment? Supervisor Baker?
Yes, I just have a question. The resolution doesn't seem to make sense. It's a reappointment to an unexpired term. I just didn't quite understand that.
Yeah, it's not an unexpired term. It's the balance. The term is supposed to run concurrent with the board's term, and for some reason, his original appointment expired in the middle of this term, and so this is to actually make it run concurrent with the current term and expire April of next year.
Okay, thank you for that clarification.
Absolutely. Any other questions on that appointment? Okay, we'll move on to item 9A2, and I would ask the Corp Counsel to provide a review of the motion to reconsider and how that comes about.
Sure, absolutely, Mr. Chair. So under our rules, if a member who was on the prevailing side of a vote, in this case, on this appointment, the prevailing side was the no vote. If a member is interested in bringing a motion to reconsider, they can request that the chair agendize that for action. The motion, again, has to be made by someone on the prevailing side of the vote. It can be seconded by any member. Once the motion is made and seconded, it can be discussed. It is a majority vote to reconsider. If the body votes by a majority to reconsider an item, then the issue of the actual underlying appointment would then return to the floor and would be agendized then for Tuesday's meeting as the agenda indicates tonight. So that's the process in a nutshell.
Okay, any questions on that? Okay. Okay. Go ahead.
Thank you, Chair. Do we know the person who was on the prevailing side that requested the reconsideration?
Yes, I do. That would be Supervisor Lamont.
And he voted no on the...
He voted no on the original appointment, and he contacted me in an email and requested that there be a motion to reconsider, and he can give you his response as to why. Supervisor Lamont.
Thank you, Mr. Chairman. I speak in favor of reappointing Mr. Mortensen. I feel that we only heard half of the story at our July voting meeting. The letters of support that we've received tonight speak volumes, I feel, of how he is appreciated and highly qualified with knowledge and experience that seems to be invaluable to the village presidents who have written, and also to the Rib Mountain Metropolitan Sewage District has unanimously wanted him to come back. So I thought it would be due diligence for us to give him more consideration. Thank you.
So you're offering then the motion to reconsider?
Yes.
Thank you. Supervisor Langenhan.
Can
Is there a second?
Can the second come from somebody who?
The second can come from any member of the board.
Sounds good.
And you're making the second? Yeah. Okay, the second is for reconsideration. So now we're at the point of debate, and we can debate the motion to reconsider. Again, we're debating the motion to reconsider. Supervisor Langenhan, did you want to offer the discussion on debate?
No, I was simply seconding Supervisor Lamont's motion. Thank you.
Okay, Supervisor Shafinsky.
Thank you, Chair. First of all, I'd like to clear up a little bit of misunderstanding about the process. I think that it was unfortunate that the characterization that went back to the Rib Mountain District was that we had rejected the reappointment. The intention was when I made the motions that I did, and I, by the way, fully support reconsideration, was that issues or questions had been raised, and what we needed to do was step back and pause the process until we heard both sides of the story. That is not the message that was delivered to Mr. Donaldson. So it seems like there was some confusion or miscommunication or perhaps misunderstanding in that communication, but the intention was to hear both sides of the story. So with reconsideration and earlier tonight, we have now heard both sides. So thank you.
Yeah, I'm going to have the Corp Council address the procedure now that we have before us.
Thank you. I guess I just wanted to, regarding the vote from last month, the vote was no to the appointment. So in effect, it was a rejection of the appointment. I think looking at the process, if the board wished to or wishes to delay action on an item, I think a motion to postpone to a time certain would be an appropriate way to do that. The action of actually voting no on the motion that was before the board, in effect, rejected the previous appointment. So that's why a motion to reconsider was required to bring it back up today.
Other discussion? Other discussion? So we're at a point of taking a vote, and the vote is on a motion to reconsider. And so what that does, a yes vote, will put it back on the agenda for reconsideration, and we will be back at a debate on the motion that was made last month on Tuesday. So again, if you remember back what the motion was on last month, Tuesday, the motion was to approve, and there was a second. And so if you vote yes, it will be back at the table, on the table, with a debate, and starting the debate of whether to approve Mr. Mortensen's appointment. So a motion to reconsider, a vote yes, will bring it back and bring it back to at discussion point for next Tuesday's meeting. A no will then remain with a no vote, and we will not bring it, if the motion to reconsider fails, there will be no other opportunity by this board to take up that appointment at all of Mr. Mortensen to that position. Is everybody clear on what you're voting on? Any questions? Supervisor Shafinsky.
So just help me understand, thank you, Chair. If we went ahead and the vote was no again, and the motion to reconsider failed, that appointment or that initial appointment or request for appointment from the board would have been rejected by the county board. Okay.
Correct.
At that point, does the Rib Mountain Metropolitan Sewerage District have the option at their own discretion to say, we're just going to bring it back to you anyway? You know, and then at that point, we have to deal with whoever they bring forward.
I'll allow Corp Counsel to answer the question because it stems on a procedural question and Robert's Rules question.
Thank you.
And I think actually it's also a operation of statute. The appointment is the administrator's appointment. So if the board votes no on the motion to reconsider or votes no on the appointment on Tuesday after reconsidering, the appointment of Mr. Mortensen would be rejected. The administrator would be tasked to bring another appointment to this body of a different person.
Mr. Chair, if I can, that's what.
Administrator Robert.
Thank you.
Leonard.
Your vote was no to appoint. So I didn't bring Mr. Mortensen back because you gave me very clear direction to get a new appointment. Which is that why I know it's complex. That's why I sent the email laying out kind of what happened. I reached out to get a new appointment from them because, as Corp Counsel indicated, that's by operation of both ordinance and statute, I am to bring an individual forward to you for you to consider for appointments to this commission. So when as I put in my communication, when the commission came back and said, we'd be interested in bringing Mr. Mortensen's name forward again, I was very transparent in my conversation with Mr. Donaldson. We had a nice chat. I said, I can't do that. I can't bring a name forward again. If you'd like to talk with Chair Gibbs about reconsideration in that process, I provided the contact information for Chair Gibbs. But the direction, there certainly was discussion, as was alluded to by Supervisor Shafinsky, about postponing, but there was no motion to postpone. There was a direct vote on the motion to approve the appointment, which failed, which then causes me to have to bring forward a new name. But just to kind of walk you through my thought process, I was just simply trying to truly be responsive to the will of the body, which was the no vote.
Supervisor Shafinsky?
Thank you for allowing the follow-up. I think what we have here is a little bit of confusion that happened because the idea that the proper way to pause the process and allow for a rebuttal would have been to entertain a motion to a time certain. And unfortunately, that knowledge, that process was not brought forward back at the last meeting. So that's how we got here. So that agreed, that would have been a better outcome. Thank you.
Supervisor Straub.
Thank you, Mr. Chair. If the motion to reconsider is approved tonight to bring to the full board voting meeting on Tuesday, will there be an opportunity to submit further evidence to show the character? As Mr. Corporation Counsel understood, on July 20th, I brought in a verifiable open meetings law complaint against the applicant. Will I be able to submit that so the full board can have a review of the, because I heard from Mr. Donaldson today that it was this individual kind of painting it out like I'm attacking him, but I've got 3 people on this sheet that can verify to the character of the applicant. Thank you.
So procedurally, there will be a debate on, if the motion passes tonight, there would be a debate on the ultimate decision whether to appoint or not appoint on Tuesday, so that could be brought up.
Can I
during
submit this in the
debate.
packet then?
I don't see any reason why you couldn't.
Thank you.
Okay, is everybody clear now what we're voting on? Again, the motion on the floor is a motion to reconsider. A yes vote will put the motion of considering appointing Mr. Mortensen to the Rib Mountain Sewerage District back on the agenda for Tuesday to begin or to continue debate on that appointment moving forward. A no vote, if that is successful, will end and will not allow that to be brought forward again during this session. Is it clear? Any questions of people that are online? All right, we will proceed to vote.
Supervisor Krause, would you vote, please? Supervisor Hardinger, would you vote, please? Supervisor Vensky, can you vote, please? Supervisor Opel, can you vote, please? One more time, Supervisor Krause.
I vote yes.
Thank you. Supervisor Hardinger. Supervisor Vensky. Supervisor Opel. Supervisor Opel, can you repeat that, please?
Aye.
Thank you.
Yes.
Thank you.
And we'll proceed. And the motion passes, and that will be on the agenda for next Tuesday. Moving on to item 9B, ordinances. 9B1, Town of Marathon rezone. Chris Fieri and Jerome and Christine Bloom, Robert and Kelly Bloom, and the James Bloom Trust. Ordinance 24-23. Any questions on that ordinance? Item 9B2, the Town of Frankfurt rezone. Tim Vreeland for Tim Brubaker. Town of McMillan, item 9B3, Town of McMillan rezone. Christopher Schumacher for Philip and Darlene Carlson. Ordinance 26-23. Town of Spencer rezone. Tim Vreeland for Backcountry Manor, ordinance 27-23, item 9B4. Okay, moving forward, item 9B5 from the town of Wayne, rezone. Tim Vreeland for Selma Menzner. Ordinance O-28-3. Okay, item 9B6, amendment to Chapter 19 of Marathon County General Code, Ordinance 29-23. Questions? Supervisor Robinson.
I have a question of Supervisor Monahan. In your discussions on this, I know we've been looking at revenue, but was there any evaluation of the citation chart and the fines? Some of them seemed pretty low.
Supervisor Langenau, please.
I can honestly, thank you, Mr. Chair. I can honestly say that between the discussions that we've had with Chapter 19, we haven't had discussions about citations in regards to violations in the county parks. That's something that we could certainly take up at a near point in the future. And I don't know if the director is joining us this evening, but I would like to know, hi, Jamie. When the last time we updated the citation schedule for parks, do you recall? Okay. I'm certainly open to looking at that in the future, and it's something we could take to Park Commission.
And we can try to have an answer for you on Tuesday. Sure. Any other questions on amending Chapter 19, Ordinance 29-23? Okay, moving on to item 9B7, update to Chapters 3 of the Marathon County General Code, Ordinance 30-23. Questions? Okay, moving on to item 9B8, amendment to Section 5.2, Parent 5 of the Marathon County General Code, Ordinance 31-23. Okay, moving on to resolutions. 9C from the Environmental Resources Committee. 9C 1A, approval of the local zoning ordinance amendment, Town of Ringgold, Resolution 40-23. Questions? Moving on to item 9C 1B, approval of the local zoning ordinance amendment, Town of Wausau, Resolution 41-23. Any questions? Okay, moving on from the Extension, Education, Economic Development Committee. Item 9C2A, a resolution providing for the funding of the Marathon County Historical Society and McDevco in 2024's annual budget. Resolution 42-23. Any questions? Supervisor Drabek.
Thank you, Mr. Chair. I was just wondering, could that be split up so there was, you were voting on one then the other? You may want to vote for one and not the other.
You could do a motion to divide on Tuesday and then divide the question, and that would create separate resolutions for each of those funding, and then you could vote on each of them separately. Again, that's assuming that the motion to divide passed. Any other questions? Okay, moving on to item 9C3, Health and Human Services Committee. A resolution providing for the funding of North Central Community Action Program and United Way 211 in the 2024 annual budget. Resolution 43-23. Supervisor Cavelli.
Thank you, Mr. Chair. This is just for informational purposes for the board for Tuesday. I'll be bringing forth an amendment to this resolution in the section where, and I don't know if you can bring it up on the screen or not, where it says, "Now therefore be it resolved." And just a little background while they're bringing that up, and I think the amendment that I'll be bringing forth will give the administrator a little bit more flexibility in putting together the budget. So the amendment that I'll be bringing forth is where it says, "Now therefore be it resolved that the Marathon County Board of Supervisors directs the administrator to provide funding in the administrator's proposed 2024 annual budget to NCCAP and United Way 211 in the amounts," and this is where it's going to change, "at a level up to the amount provided for in the preceding year's budget and not less than 8% below the amount provided for in the preceding year's budget." And then the fiscal note I'm looking at bringing forth is passage of this resolution would direct the administrator to include in his proposed 2024 annual budget funding for the two listed nonprofit agencies at a level consistent with the funding provided in the 2023 budget, and this is where the change comes in as well, at a level up to $33,757 to NCCAP and $40,000 to United Way 211. However, any amounts actually allocated to each nonprofit organization must be approved as a part of the 2024 budget. Thank you.
Thank you. Any further discussion? Okay, moving on. Human Resources, Finance and Property Committee, a resolution unencumbering unused ARPA funds. Resolution 44-23, item 9C4A. Supervisor Sherfinsky.
Thank you, Chair. So my question to you is this, and I understand that 9C4A and B are somewhat tied together, or at least that is the intention, that possibly using some of those ARPA funds would be used to fund potential capital improvement projects. I do have a question in an email out to corporate counsel who has not yet responded but is working on a response regarding the use of ARPA funds or somehow using those funds differently within the county budget so that we could free up other monies to start paying down and take care of our debt relative to the North Central Healthcare Project that was voted for in years past. My question is this. Is there any unintended consequence if we vote to unencumber the unused ARPA funds and that passes, but the resolution approving the capital improvement projects does not? I just want to understand whether or not we unintendedly dig ourselves a hole. Thank you.
No, the resolution unencumbering is the official action by this board with the filing to the federal government, the U.S. Treasury, and letting them know that we no longer have allocated these funds from ARPA to and in that reporting responsibility. It then moves those funds back to the account where ARPA funding originally was funded or was placed, with the restrictions that the federal government has placed on the use of ARPA funding. One of those restrictions is clearly spelled out that debt service cannot be an ARPA function. So the caution that I have heard multiple times from multiple sources, from NACO, from WCA, from legal counsel, on various boards and commissions as it relates to ARPA funding is be very careful and don't do an end run around using ARPA to cover debt. So, but to answer the second part of that question, is there any, the CIP is a list that does not effectively tie any funding to any CIP project at this point. Clearly, what this resolution does is just unencumbers those funds, puts those back into the ARPA account, and allows the finance director to file with the Treasury that those funds are no longer allocated out of ARPA. They're back in the ARPA account. Other questions? Supervisor Dickinson.
Thank you, Mr. Chair. So if this passes and the funds go back unencumbered, is there some sort of plan of where to direct those monies already kind of churning? And in addition to that, if so, is there going to be an attempt, or can there be an attempt to offer up requests again, as we had done prior, where people could go online and then they could submit requests? Or is that outside of the time frame?
I think this board's already passed in its intent was that it's in the finance budget priorities, that its intent was to utilize ARPA to fund CIP projects. It's not to say that it's going to, but it said its intent was. But that being said, I don't know that the Finance Committee has sought to reopen a process soliciting outside interests and outside projects outside of the county's projects. Supervisor Robinson.
I'd just like to reiterate the last point. I think when you look at the rounds of solicitations that we've had, we tended to reject a lot of the ones that were outside of the county government because of a number of things, including proportionality and eligibility and other things. I don't think it's the intent, but ultimately the decision on how those monies are spent are up to this board. If you do it outside the budget, it is a 2/3 vote. If it's done within the budget, it's a majority vote. And anybody can bring forth a proposal for consideration. It doesn't guarantee that it will be funded, but we've decided to not use that solicitation process. It didn't work particularly well, and we created expectations among people that we couldn't meet, and therefore the decision was to stop that, and with the budget assumptions, I think it was to focus but not necessarily commit all of the dollars, ARPA dollars, on capital projects.
Understanding still the federal requirement that the ARPA dollars, as it reads today, must be committed by December 31st, 2024. However, they must be spent currently under the current rules by that Treasury has put out in guidelines by December of 2026. Supervisor Lamont.
Thank you, Mr. Chairman. Just a quick question. How much money are we talking about, and was there some major amount or what wasn't unused?
Well, if you remember when we did the budget last year, initially we were going to use 10 million of ARPA for highway funding, and then we abandoned that because there was conflicting reports that said that would have an impact on our 6-year rolling average, and we ended up using highway reserve instead. So that funding has not been spent. And the broadband expansion was encumbered for a grant that was written for a service provider that was unsuccessful. So that was being pulled back. The Uniquely Wisconsin, we initially apportioned 60,000. There was 10,000 that was provided by the Visitors Bureau, and then originally there was a dollar amount for the buyback of the liability of PTO from the pandemic, and not as much money was needed. So that's what that 10.75 million is being pulled back, put back into the account to add to the roughly 5 million that also sits there unallocated. So there will be roughly 15 to 16 million of unallocated funds in the ARPA accounts. Other questions? Okay, we will, Supervisor Shafinsky.
Thank you, Chair Gibbs. One final question. Do we have all of the North Central Healthcare project complete at this point? Or are there any other, phase 2, phase 3, phase 4, whatever it might be, that has yet to come forward?
We'll get to those questions when we get to the next resolution and a presentation on the CIP project lists. But as far as for North Central Healthcare itself, no. But there's a section in that campus that's a renovation that wasn't part of the original renovation originally. Administrator Leonard, do you want to provide some clarity?
No, I think we're better off. I won't make your meeting longer. Chris can talk about that when he does the project list that you referenced.
Thank you, Chair.
Any other discussion? Okay, next item, we have the resolution for the 2024 Potential Capital Improvement Program Projects, Resolution 45-23, and we have with us Deputy Administrator Holman, and he's going to provide an overview of that project.
Okay, thank you, and good evening. So Troy and Craig are handing out sort of an updated form, and so what will eventually be in front of you and on the screen here is a result of guidance I received from HR Finance at their last meeting. And it's essentially the same information that was in the packet and presented to HR Finance, but there's just a little more context and additional info about projects that have non-county funding, and I'll point that out as we walk through this. But I'll work through this particular document as it's the most up-to-date. I want to stress, as was earlier mentioned, that this is simply a list of potential projects only, and though there are costs associated with them here on the screen and on the document in front of you, the discussion and any action you take does not commit funds or guarantee that a project on the list is ultimately funded as part of the budget. And similar to the guidance I received from HR Finance, if there are pieces of information you want to see beyond today or for Tuesday or before the budget is ultimately adopted, we can certainly bring back information at a future HR Finance meeting or board meeting. Troy and Craig are here today. They're both heavily involved in CIP. They are project planners. Troy is primarily a North Central lead, and Craig works on a lot of the other CIP projects outside of that campus, though we all work on pretty much everything together. So they're here to help provide any answers that I might not have. Lastly, I also want to note that we won't likely have enough funding. Well, we won't have enough funding to cover everything on the list. So some projects could reasonably be deferred just because of available funding, but also because of decisions that you make. And I think other projects just simply won't be funded, which is a regular occurrence each year. So that said, I didn't want to make any assumptions. So the list, which has been evaluated by facility staff and reviewed with the administrator, is one that really is providing you with a big picture look at this point and contains some decision points to consider as part of the budget process. So the form itself is probably familiar to you in the sense that it's the form we use when we start getting allocation of funding and a more focused picture on what available funding is actually there. And that's mostly reflected on our right-hand side. So when we get to the part of the budget where we are actually allocating funds, you'll see in those columns where the funding comes in. On the left-hand side are the projects. Some of them are recurring, some of them are things that departments submit each year. And I'll make another couple of comments when we get to the rolling stock portion. But I'll just walk briefly through each one, and if you have questions, I'm not sure, we can handle them at the end or as you see fit. But essentially, I'll just start at the top of the list with the projects not funded by CIP. That may change with the first item on the list, which is the bituminous surfacing, which is essentially Highway's annual paving program, which is approximately 30 miles per year. You'll see that the project request cost is just shy of $3 million. The overall cost is just shy of $6 million because half of the funding would come from the registration fees, and that's the $2.96 million you see on the far right. So highway funding, if you recall, sometimes, as mentioned previously, comes out of highway reserve. Sometimes tax levy has been used. Sometimes borrowing has been used. There's a variety of different funding mechanisms that have funded highway projects traditionally. Similarly, the replace and rehabilitate county bridges and culverts and replace and rehabilitate federally funded bridges and culverts, those are reflected further down in the list, and I've referenced in parentheses each one of those lists that would fall under those umbrellas. The information-only items are from our enterprises at CWA and Solid Waste. So these are projects that we track within capital improvement planning, but they don't have a specific county funding request. If it's CWA, they're likely getting funding from the federal government and the FAA. If it's solid waste, they're getting a lot of their funding from their long-term reserves and their own operational funds, which is just part of how they run their shop. So that total there is just showing that aside, you've got the highway included, but just shy of $10.4 million is funding that most of that is not being requested from you. The recurring projects, these are projects that are there every year. It doesn't necessarily mean they have to be there every year, so these, anything can change. But the first one there is the county facility parking lot fund. Now, this particular fund is most often used for repairs, patchwork, potholes. We had a big pothole out at the juvenile center this year, for instance. Things like that. You're not necessarily paving entire lots across the county with $50,000. I don't think we have very many lots that $50,000 would actually cover in terms of lot replacement. The annual playground replacement and restroom replacement, as I understand it, those have been in previous budgets and are longstanding recurring items as well. The technology projects, there's several of them recurring, so you see those each year in the budget coming through from CCITC. The PC upgrade fund, network server upgrade fund, video equipment, and phone system upgrades. And then below that are the projects that they've requested specific to this budget year. So the first one of those is Workday enhancements. So if you watched any of the Workday update video from the HR Finance meeting, you heard that there are multiple phases of implementation to the system. And so going live, getting payroll, and those initial pieces going was the completion of phase 1. Then phase 2 is taking on the other modules within the system and further developing them, such as budget planning, reporting, things like this. And so if you think about Workday as a core system, the enhancements are things like getting more complex reporting out of the data that Workday can provide for you, and really customizing the system to do what you need to do rather than what Workday thinks you need, because ultimately it's a system that's used globally, and every user is going to have a different tweak on what they need Workday to do for them. So that's the enhancements piece. The Move Critical IT Hub off of River Drive. So this is assuming that at some point the county would be moving away from the River Drive area where this IT hub currently exists. So if that were to come into play, then you would want to move that IT hub away from those properties and into a different location so that the county's IT situation is more stable, and you don't have to worry about if you either divest them, lease them, whatever happens with those properties, there's not an IT component that you have to worry about solving at that moment in time. So this is more of a forward-thinking project based on where things are at today. The update West Side jail cameras is just that. There are cameras throughout the facility, and on the west side of the jail, those are the more dated cameras that need updating. The city-county asset management software, this is something that will be a joint use between city and county. The asset management is something that everybody's involved in, but there's not necessarily always standardization to that. So this would pull that together and standardize the process, and also be something that can be integrated in Workday for the city and for the county. Excuse me. The assembly room microphones, I'm sure you're very well aware of this particular issue, so I won't speak to it too much, but essentially would move away from your current setup to something more like this fixed system where you wouldn't have to worry about batteries and is the microphone working, things like that. So updating the ability of sound to work for your meetings and other meetings that happen in this location. The contract management software, this again is taking something that is spread out across the county and across the city in different ways, and then consolidating it, standardizing it, and then finding how to integrate it into the Workday system. It's also, I would say, and this is just my understanding, I think Corp Counsel is more familiar with the process that took place years ago, but there was a concerted effort to take different interpretations of how to do contract management across different agencies and standardize that so that everybody's on the same page. So this would be sort of formalizing that in a software platform. And the very last one for CCITC is tied to the fiber optics projects that the county's been working with Bug Tussle. So there's a lot of what you would call dark fiber out there in the sense that it's not being used. So this project would then facilitate the turning on and operation of that fiber for the county. The rolling stock, this is something that HR Finance is still investigating and looking into because you likely recall that the funding amounts here have been static for better part of a decade, 12 years or so. So it's been a long time where those funding levels haven't changed and haven't adapted to market realities. And so what Highway could buy for that amount 12, 13 years ago is not the same as what they can buy today. And so in addition to looking at what is the reality of the funding situation today for the rolling stock, we're also looking at the rolling stock policy, which included things like the funding amount should be an average of the last 5 years, but the amounts never change. So the policy needs to be revised. We've got some draft language put together, and at their next meeting or maybe next month, depending on what Chair Robinson would like to do, we'll have a policy draft to work through with them. And that would lead to proposed changes to the funding levels in those areas. The other projects, I've listed the details of what they are, and if you looked at the project request forms, there's a lot more to each of them. The emergency management one is more straightforward in the sense that there's two vehicles there that emergency management would consolidate into one, so more of a vehicle replacement piece. The medical examiner request, they've got aging vans, they have 3 existing vans, and then there's also two parts of this. So as part of the Forensic Science Center project, if the funding all comes through with that and we move it forward, there's a livery service aspect of those operations. And so there would be a refrigerated truck that would allow those livery service operations and associated revenue to come in as part of the overall Forensic Science Center and what it does. The other one is the facilities and CPZ lease. That's been an ongoing lease situation. And all 3 of those areas are areas where we've been looking at what are the lease options. So do we need to do a straight up vehicle replacement like we've done in the past, or are there leasing opportunities where it would allow you to effectively better leverage the funding you have now and then sort of stretch that over a longer term plan so that you don't necessarily have to come up with a lot of funds all at once to buy all these vehicles and then drive them into the dirt, if you will. You could get into a lease program where you can build some equity and lower your cost of operations for vehicles. A real simple way to explain one aspect of a fleet management program is that currently, like if I take my car and I go somewhere on behalf of the county, then the IRS says I get 65 cents per mile. So if you extrapolate that across the county and anybody who's using their private vehicles for county business, they're getting reimbursed as they should for that mileage. But when you look at a fleet option, then you can lower the operation per mile cost down to, roughly, a 30% less. So then there's an opportunity there perhaps for realizing some savings just from what we're already spending in terms of mileage reimbursements and saying, well, we can take a fleet option and just on that one factor alone reduce our costs just because the operations and the program, if you will, allows you to get vehicles that offer you a quicker replacement cycle, more modern technology, better safety, and so on down the road. And so those conversations are ongoing. They should be wrapping up within the next few weeks, so we get a firmer picture on what would the near term look like for a fleet option, and then what would sort of a long term look like. So If you had a lot of vehicles in play, then you would stretch that out over a few years and figure out what do you really need to take that 4-year cycle of a fleet, wherever it might be, and just run it over time. Because once you get into the fleet program too, you generate bits and pieces of equity which fold back into the program and essentially capture the benefit of purchasing vehicles from the government as a government entity. So you recapture part of that benefit and then incrementally lower your costs over time. Maintenance costs will go up just as the market will, but long story short, we're seeing if there's funding opportunities there just to save money and to be continued. Sorry if that was a bit confusing.
Can I add one thing to that? So Chris gave you the example if he drives, but Chris and I, we're pretty much levy funded generally. We have a lot of programs that you'll hear about later with Krista, if you have questions for her in one of the resolutions. We have grant funding, just like North Central talked about. So we're investigating the opportunity to use a fleet and have a fleet service fund where we're still able to charge the fleet service fund the 65 cents per mile. So seek reimbursement from the grants for that, but our operating is less. We're looking into whether we can use that gap essentially to fund the continued expansion and replacement of that fleet. Because like Chris said, you know, the vehicle 12 years ago, the vehicle that we were able to buy, you can buy half that vehicle now. So this is a real opportunity. We've been using it for a couple years in other departments, like Chris said, but seeing what those expansion opportunities are. And I'm really excited about the potential on the grant side.
Great points. And obviously, any questions you have tonight or moving forward, feel free to reach out to me anytime and I can give you a lot more detail. I just know I'm trying to get through this a little quicker just because I know you have questions and it's been a long meeting. For the last portion, this is the bulk of the projects that were submitted as requests from departments. And so facility staff evaluates them based on, is there a regulatory component? Is it an end-of-life component? Is it something that's new and more of a want that might have other angles to it? But what's in front of you there is something that we've evaluated and then reviewed with the administrator. As I said before, some of these projects won't be funded. Some of them could be partially funded depending on how you looked at them. And I'll get into some bits and pieces of what I mean there here in a second. So the top one is the Forensic Science Center. You're very familiar with this one. I put the $11 million over in the right-hand column under other because we know that the states looked at as supporting it at the $7 million, and then we've committed as a county $2 million, and then we know that there's $2 million more that are pending from the federal government. And then there's a concurrent to all that, there's an ongoing fundraising, working with different community foundations and others to figure out how we can complete the funding for that particular project. So that one I won't belabor the point. The next one is exterior signage. So this gets back to the campus. And real quick, the campus at North Central or Lakeview, the Lakeview campus as a whole, the county owns, okay? So then, but the buildings within that campus, we lease to North Central, but the signage here that we're talking about, and the reason there's an 85% Marathon County, that's what MC stands for, and 15% North Central, is that both of us had a need for signs given that they've moved to a different part of the campus within their buildings and just in general. And then Marathon County's got social services and other potential departments moving on there where you'd want to have wayfinding so that people know where to go. So rather than run separate RFPs, we had a meeting and said, look, if we both have a similar need, let's just run a joint RFP together. And so by building the budget number for this, we reached out and said, here's what we're looking at needing, and 85% of the cost you see of the requested funds would be Marathon County signs, primarily looking at the campus as a whole, and then 15% would be more program specific to North Central signs. And if you've been out there now, a lot of the signage is temporary. So it's not very durable, but there's also a point to some of that as well, because you don't just point it to a spot in the ground and throw up a sign and hope for the best. You can use temporary signage to gauge, are these sign locations actually working? Are people getting to where they need to be based on where we have signs? So you can kind of figure out where's the best place to put the sign, what needs to be on that sign, and how do you get people to where they need to be most effectively. And so that's kind of part of what we're doing right now is making sure that truthing out where we would put the signs and also what signs you'd want to have in place. And I'll just make a note on this one. When I mentioned earlier that there's there's different ways you can cut some of these projects up if we needed to. This is one where if we said, look, we really just need to have those, you're coming in off of Lakeview Drive, you're coming in on Marshall, we need those signs as you come onto the campus. That's what we really want to see. And so then you could focus on those this year, and then in ensuing years, you could build the signs out as you walk into the campus. The 1100 Lakeview Drive construction, this is what we came to you earlier in the year for the design. So that schematic design process and final construction costing has been completed this year. So that number there reflects the work that went into refining that conceptual piece and drilling down into what the actual overall cost would be. This portion, I should also clarify, back to the earlier question, is not for North Central. So North Central is vacating this space and moving into their new location. This is the space where the outpatient clinic, where HR, admin, and finance for North Central currently are and are actually currently moving out of. They started moving this week. So that space is what has been proposed for other county departments to move into. So that part of the facility, we need more of the county side adjacent to where social services and public health are right now. So this particular project would not be involving North Central. The only tiny portion of that would be maybe APS, the Adult Protective Services. Other than that, and they would be co-located if the ADRC ultimately decides to move there. They would be co-located together because they work with some of the same populations. And they currently have offices across from one another in their current location. The next project is replacing chillers and really the entire HVAC system at the building that the library is in currently on First Street. So this is, real simple way to put this is that the equipment and everything associated with the HVAC system in this building is at end of life. It's 30 plus years old. So you're not just talking about the chiller, although that's been predominantly what is driving the cost, because it's a big building. You need a big chiller to cool it down. It's air handlers and everything, ducting, changing from air cooled to water cooled, using DX or glycol in areas so that you can use that to more efficiently exchange heat within a system. But it's not just one small piece, and that's why you see the cost is $2.8 million there. And I should also note that even the status quo has a sunk cost to it. So if we ultimately decided, look, we're not going to update the HVAC system in that building to replace everything as it is, you're going to still spend upwards of $1 million to replace the equipment that's in there and at end of life. And then you're also still integrating into a system that's water chilled, which at HR Finance I showed the water bill from last year, and you're essentially paying over $50,000 a year for water right now. And that rate's going to go up, and then over the life, if we invested $1 million in the status quo, those rates will go up over the next 30 years. And so, but even just at the current rates for water, if you move away from that and assume that rates never increase for the next 30 years, you're still going to save over $1 million just in water bills. So when you start piecing together not only modernizing the equipment, moving away from the water bill, and then also having equipment that's not dated, harder to find parts, which is increasingly difficult with some systems, and also just ease of work, something that might take an hour or 2 hours now to work on because it's an older system, you might be able to just fix on your phone because now it's fully automated and you don't need to go in and haggle with a compressor because your pneumatic system is not working correctly. So sorry if I'm belaboring that one a little bit, but I think it's important to understand why that particular project has that price tag. The replaced pavement of courthouse on the east side parking lot, that's the one right outside this window here. And the reason I mentioned the parking lot fund above is because at HR Finance, they correctly pointed out that why would we have a parking lot project on the list when we have this replacement fund? And the short answer is we could certainly use that replacement fund to address that issue. That's something we can definitely do. Now the cost is a little higher, but it's marginal. You could find another $14,000 to do it. But the point is that the parking lot fund typically isn't used to replace an entire lot. It's used to address problems within lots across the county. The $700,000, that's for upgrading and replacing the sanitary and plumbing at the Lakeview Professional Plaza. Again, this is where the Birth to 3 program works with social services and the special ed program. They are housed in those facilities. These are buildings the county's invested heavily into remodeling these last several years. So this would be essentially the last fundamental piece of what makes that building work. And so there's a lot of space in that building that could be utilized for different agencies and leasing to them. But the sanitary and plumbing is in a situation where there's a real danger that some of the pipes, the larger pipes underneath the building will start to collapse because they're so old. And when we started looking into that project and saying, well, maybe we could look at sleeving it with PVC because it's a cheaper option, it actually turns out that it would exacerbate some of the problems we're having because it would narrow the older pipes even more and restrict their capacity. And so then when we looked internally, the plumbing within that building and it was not updated. So you're still dealing with cast iron pipes that are 1.5, 2 inches wide. So you've got issues with, lack of a better phrase, flushing the toilet. So you wouldn't want to lease out that building to other agencies and put more people into that building until you resolve that. Now, does this have to happen tomorrow because the system is going to collapse in 20 minutes? No. But it is something that, at least fundamentally, for the underground pipes we know have serious issues. We need to address that in the near term. But this, again, we fast-tracked on the design, because sometimes we bring in a budget number that's not fully vetted out in terms of construction cost. We've already done the RFP for the design to get you a more final construction cost number so that if you decided to do that this year, you would have a very specific number to work with versus a rough estimate. The following projects are all highway projects. The highway projects all have a nice benefit over here on the far right side. You'll see that these are cost shares. So if you've ever been in an infrastructure meeting, Commissioner Griesbach would certainly say, if you get $1 for every dime in your pocket, he would give you every dime he has. And so the matching funds over there are state or federal funds that are a portion of the overall project. So the funding request in CIP is just the county's portion of the overall project. So you can see that the total project would be adding together the CIP request and the matching funds on the right. And the first three are resurfacing projects. Then you have bridge replacements and culvert replacements below that. One thing to note about this is that we do have bridge and culvert aid. And so it might be logical to think, well, can't we fund that with bridge and culvert aid? It's a separate part of the levy. But that particular aid is for municipality projects. It is not for county projects. So these are bridges and culverts that the county owns and we need to fund. And that's what the difference is. The last couple for highway here are the Abbotsford Highway Shop. So there's two primary issues there. One, the pavement is nearing end of life, but there's also a lot of subgrade drainage issues, which just means the water table is very high. So when you have water involved with ground you're trying to pave and move vehicles on, and you see this every year with weight limits being put on and lifted, you can really hasten the demise of your pavement if you don't handle that correctly. So for this particular lot, this year what Highway has already done is put in drain tile to facilitate moving water away from that subgrade situation. Farmers do this a lot with very wet fields where the water table is high so that they can actually plant the field and not have their fields be swamps. So if you've heard of drain tile in that context, it's very similar. So once the drainage issue is addressed, then the plan for Highway with that particular project would be to repave that parking lot. The design item there is something that Highway puts together every 2 years. They've got their design RFP out right now. And Commissioner Griesbach explained that it's on a 2-year cycle, and that's essentially helping to get the design aspects done for the STP projects like those listed above. Moving on to the CPZ project, it's a hydro seeder. So this is something that CPZs recognize a use for themselves. There's also an aspect that Highway could use the same piece of equipment. It would move you away from renting or I don't even know if you can lease one, but this is a piece of equipment that a lot of the time everybody needs all at the same time. So availability can be an issue, but also there is a plan that if this project were to be funded, that this piece of equipment would be also rented out to municipalities who have a need for the hydro seeder for their situations. And so then it would be a part of a county municipality partnership for when they need this piece of equipment, we'd have it for them. The parks, the first parks project, this is the Eastgate Hall. So Eastgate Hall is one of the larger venues that generates revenue for the county and for parks. And I broke this down into different pieces because, again, this is one that you could phase over time if you wanted. So Of the pieces that are on that list, the ones that you would probably want to attack first if you chose to would be the flooring and the acoustic tile. Essentially because the flooring in there is over 25 years old. When they first put it in, there was a leveling agent put down. That's all been pulverized. So now in certain parts of the floor, if you're stomping around or dancing at a wedding, little puffs of powder are coming up. It's not harmful to anybody, but what happens is when that leveling agent deteriorates and starts puffing up through the air, then the tile starts to crumble, then it starts to peel, and then you have a problem that just starts building on itself. So the flooring, based on the traffic in there, would need to be replaced. And then the acoustic tile, if you've ever been in there, it's just a very loud place. You know, it used to be a gym where you could play basketball and all that, so people don't get too upset about a loud, raucous gym when people are playing basketball. But if you're there for a wedding, short of the music at the after party, a lot of times people would rather have a more muted experience, and so that's what the acoustic tile would accomplish. Of course, the other aspects are just lighting and electrical. These are upgrades that you would want to modernize the venue. The windows and the siding are effectively tied together because it's metal siding, and the way that building is built is very peculiar. And the last remodel, if you want to call it that, for the windows was essentially wrapping the original windows in aluminum. So not really a remodel per se, but the point I'm trying to make is that if you want to change a window, you have to take off the siding. If you take off the siding, you're not getting it back without a bunch of dents and tweaks and tears. It's not going to be pretty. So you really want to do both of those at the same time to get the end result you're really going for by replacing them in the first place. The next project at Dells of the Eau Claire, there's different aspects of this. There's adding bathroom and shower facilities and camper cabins. These would be more revenue opportunities potentially. And there's been questions and discussion at HR Finance about how the county can look at projects like this to figure out what would the return on investment look like, or how could you even route some of the revenue that parks would generate through these types of projects into a fund that would help fund these things moving forward. The replace dump station item, this is something that's tied to a change in state law for the number of sites you have and when it triggers you having to have a dump station. So if we maintain the status quo as is at that campground, we've now magically, because of that change, we have too many sites and we would need to do a dump station. That being said, Chair Robinson brought up a good point at the last meeting saying, well, we could just reduce the number of sites to get back below the threshold. So that's certainly an option here where you say, well, we don't necessarily have to do a dump station, we could just reduce sites. Or we could add the dump station, add sites, there's different directions you could take with it. But if the status quo remains as is, then essentially the state rules change would require us to put that in. The Big O Plain campgrounds, again, you're adding bathroom, shower facilities. The Big O Plain is very widely used. I mean, Dells of Eau Claire is used as well, but comparatively, you've got, I think, 28 sites at Dells of Eau Claire. You've got 120 sites at Big O Plain. So if that goes into your considerations in terms of where you want to direct funds, those are just examples of factors that could come into play if you wanted to support either of those projects. The Cherokee Park project is just replacing a failing bathroom. It's an existing block construction, so you can imagine a cinder block situation at a restroom. So over time, those cinder blocks are not going to be as effective, and now you can have some leakage into the water table, and it just ties back to, in my opinion, sort of what we ask people to do with their own septic systems. This would be in line with expectations in terms of if it's failing and not modern, that facility you'd want to find a solution for, and one of them would be to replace that facility. The 9 Mile Forest Recreation Area, this particular septic system has never, well, one, it's at end of life, so it's 30 years old. It needs to be replaced like any septic system would be as it gets increasingly old, but also heavily used. But we've also had to limit the use of this facility because the capacity of the system has not really been able to match the venue's ability to have people attend. So there's a revenue opportunity there in the sense that certain groups, or larger groups, that would have been restricted from using the facility before because the septic capability wasn't there, now you could have larger groups come in with a new septic system. And this is one that also the Conservation Planning and Zoning Department has reviewed, and they've also recommended replacing it just based on the situation that particular system is in. The West Side Master Plan tie-in, this is the Marathon Junction / family area on the northern side of the park there. and this would be a planning and architectural study. I know Jamie's here, she can speak to that if, with more detail than I have, and if you have questions about that. But ultimately, it's a piece of the overall West Side Master Plan. The Public Safety Training Response Center, this is one that when we looked at it internally at facilities, there was a number in the planning documents, it was like 3.45 million, I think, where it was like, we can build new, have a new center, and it was our opinion, like, you couldn't build what you already have for 3.45 million, so you're gonna be talking about a higher number. So we met with the sheriff and chief deputy and proposed renovating and updating the facility, reskinning, re-insulating, and getting them the capabilities and capacity they need in that center, and a storage facility they have, which we could make temperature controlled. So then they'd have two pieces or two areas that would effectively get them where they need to be for the next 20, 30 years. So they agreed that that was a good idea. So this is the other project that we fast-tracked just as an option to get that design done. So that if you wanted to do this particular one, you'd have a final construction cost prior to the adoption of the budget. What you see there is that rough estimate that I know many of you get frustrated by, and I understand why, but that's again why we said, look, we've got some funding, let's fast track it and get something more definitive. The last two here are at UWSP, so, or at Wausau, sorry, or UW Marathon County for those in attendance who may be alumni. The reasons there's option A and option B is option A is what was submitted by UW's maintenance team. And just the big picture at UW is this is another area where you've got a lot of buildings and facilities with aging infrastructure. And so just one example, there's a lot of Honeywell equipment that was put in those facilities in the 80s. Now, all of that Honeywell equipment, because it's all essentially built the same, is all failing at the same time. So you're having to replace boilers, burners, anything with Honeywell on it right now is failing all at the same time. And so you've got a lot of pieces of equipment at end of life. This particular project is tied to the central heating plant. So the central heating plant heats the entire campus. And so this, one of the boilers, the primary boiler we're talking about replacing in either A or B, was installed in 1967. So it gets a gold star for longevity. I don't know how it's lasted this long, but it probably ties back into something about how they built things back when they really built things. But suffice it to say, you would not expect a boiler to last for 55 years today. Now, you might get lucky, and we certainly have. But the point about this is that it's a core component of that overall campus, which ties into all the buildings. And at HR and Finance, what I was talking about there is that regardless of who's in that campus, the county owns all those buildings. And so whether it's UW now or 10 years somebody else, or maybe, I don't know I don't have a crystal ball, but at the end of the day, this is not something like, do we put an air conditioner window or not? This is, do you heat these buildings in the winter or not? And so what option A does is it more or less reinforces the status quo and leaves fuel oil as the primary backup energy source for a prolonged energy outage. And it leaves all the pneumatic controls. It's essentially a strategy they followed, and they've done very well, I should say. They've done exceptionally well with the funding that they've been given to maintain the buildings, which per year from the county side has been just shy of $59,000. They do have funding from UW's system for maintenance and the like, but a lot of that is locked up in personnel. So hats off to Gary, who retired earlier this year. He and his team have done an incredible job with limited resources. But option A is essentially just kind of maintaining the status quo. Option B, we worked with Gary and Steve Bellinger and our HVAC crew, looked at how can we more modernize this and actually pull the system not only into modern day, away from pneumatics, fully automated controls, but also allow the county to get in and monitor that like we monitor all of our other equipment. So right now there's ways to do it. It's pretty clunky. You have to get in through their IT system. It doesn't always work so well. And ultimately, you're limited by what is actually automated within that system in the first place. So they've been taking tiny steps to automate things, which essentially, you could say, if there's an alarm that goes off, you get a message on your phone. It could be something that you fix at home, and you just hit a switch, you make the adjustment, and you're good to go till morning. So that's what automation can do for you from a maintenance point of view. versus, well, I don't know what's going on, so now I got to drive in, then I got to dig into the pneumatics, did an air compressor fail, et cetera, et cetera, et cetera. So option B is a much more modernized approach. It gives the county much more of direct control over all those buildings and these particular, and the central heating plant. And it also supplants other pieces of equipment that this year failed as well, and they're still waiting on parts for. It would not necessitate that equipment being in place any longer. So you would say, here's some problematic equipment we no longer need or have a need to replace, and we'll do this approach, which pulls us away from fuel oil and also allows us to, again, have a more efficient, modernized system. So that's essentially what's wrapped up into the cost difference. And yes, sorry, that's the end of the list. So I'll leave it at that for now. Sorry for speaking at length here, but thank you for listening. I'm certainly happy to answer questions.
Supervisor Robin.
Thank you, Deputy Administrator Woolman. So if you're giving a gold star for longevity for things that were from 1967, what do you do for things from 1955? Just wondering.
We'll buy more candles next year.
I think this is not a final list. This is a starting point for discussion. The HR Finance Committee met on this, and we've got a number of questions. We welcome your input into it. These are sort of the items that were flagged by the facility staff and administration as being meritorious of consideration. We know we can't afford all of them, and we'll go back and we've asked a number of questions, and a number of members of the committee have had concerns, particularly as it relates to some of the investments in the park facilities relative to payback and depreciation and a return on investment. There are some policy issues that we need to address in here relative to, again, rolling stock. We haven't increased that in years, and the highway department and, well, I imagine all the highway parks in Sheriff's Department have been limping along, but they're looking at leases and other approaches going forward. But I think we're also concerned about, if we've got a septic sewer system replacement, and then do we have a recurring cost, or we have individual projects and we're trying to reconcile that. But we welcome your thoughts on where to go. We know that, again, not all these will be funded. When you see this the next time, there will be more definition on the right side of the paper relative to where the funding is going to come from. Thank you again, Chris, for preparing this.
Supervisor Dickinson, please.
All right, thank you, Mr. Chair. So I just had just a couple questions on the spreadsheet. So the two UWSP Wausau items are combined in that total cost,
Yeah,
so-
it's a good point to point that out. It'd be one or the other, ultimately, if you choose to do one or the other, yeah.
Okay. Second thing is, so the total amount here, 45 million or so, registration and other, you're talking about almost 30. So really the other 15 is going to come from these other funding sources. Is that correct? Because it's not really clear on the sheet. It seems it's a little confusing the way it's totaled.
Sure. I didn't want to make assumptions about what would ultimately be funded or where it would come from. But hypothetically, like to your earlier point about ARPA, if you were to say, okay, ARPA will cover 10 million of it, then you would ultimately say, we want $10 million to go here, 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 and here. And then if there's tax levy for highway, or we use highway reserve, but that particular aspect of the funding piece, it's not defined yet. So I didn't want to make any guesses, but in terms of what the knowns are at this point with matches, that's why I included that on the right.
Okay, so that's what I was just saying. But from the general sense, you have this 45 million on the left, you have this 30 million, so that the 15 million is kind of those other categories is what we're looking at.
Correct, yes.
Okay.
Sorry if I misunderstood.
Thanks. And my last question is, so these items that are related to like sewage, sewer, like bathroom and such, is that ARPA eligible? Do we know? I know there's...
Oh, yeah.
So if you're doing a bathroom facility at a park or something, potentially that would be ARPA eligible.
You could make that argument under the Clean Water rules.
Okay. Thank you.
If I can add one thing, I think for our ARPA allocation, to your specific question, we're going to meet our lost revenue calculations will envelop all of the remaining ARPA. So you're not subject to any of the ARPA limitations on what projects are eligible, but you still have the exclusions that Chair
can't.
Gibbs referenced. The biggest one, of course, is you can't just use it for reserves or debt.
Yeah. You can't, one of the restrictions the Treasury put on, obviously, is you can't service debt with it. You can't put it in a rainy day savings account to use in a future year. It has to be spent. And as the administrator clearly pointed out, as the finance department has understood, there is the lost revenue component, and the lost revenue component will cover all of the remaining ARPA funding. So the restrictions that the Treasury has put on as far as what projects qualify really doesn't apply, other than what we can't do with the ARPA funding. Those still are in place. The lost revenue does not negate the ability to use debt service or rainy day savings account. Supervisor Stravinsky.
Thank you, Chair Gibbs. So just diving into the nuts and bolts on the last two projects, just out of curiosity, option A, option B. Help me understand, is option A included in B, or is it, I guess the way I'm looking at this, is it complementary? Could we choose to do option A in such a way that then in a future year we could come back and do option B, and now that's a $500,000 or a $600,000 project instead of the $800,000?
It's a good question, and I can dig deeper into that with our HVAC crew. I think there's aspects of it, to your point, that you could do that with. I think the challenge could be is if you replace a boiler and burners with systems that wouldn't necessarily, they would speak to more of the traditional system versus it'd be harder to automate them. It's just a potential hypothetical. Then maybe not, but certainly I could figure that out before Tuesday's meeting. Not that you're making a decision on A or B Tuesday, but I could give you that by then.
Thank you.
Can I add one other thing on that project? Just the conversation at HR Finance, going back to Chair Robinson's point about, really taking a different approach. And it might not seem like it's all that innovative, but it is a far different approach than we've ever taken before. And that's this idea of, like Chris alluded to, essentially funding depreciation so that you're not in a place for some of these revenue generating opportunities we have. You're not in a place where 25 years later it's like, oh my God, we got to find a big number again. That's not something we've ever done, and I'll just tell you, I had a call on Monday where I thought I had a good group. I'll ask all my administrator colleagues, does anybody have a good template and good process for this? And everybody said, no, we just do the thing you're doing, which is it's part of the approach. So I think that's really important. And why does that relate to the last two projects? The UW pays the bill for the utilities. So if it's in both of our interests to update this equipment, because it's going to be, to your point, Supervisor Sherfinsky, it's going to be more efficient. Well, if we both have skin in the game, they should give us some of the savings. And that's one of the things we're going to talk about. If we install this, update this system, and I'm just using, these are fake numbers, they're illustrative. If it saves them $50,000 in utility costs annually from what they had been paying with the old system, they should reap some of that savings, but we should too. So hypothetically speaking, maybe we get 25 of the 50 that is being saved. So those are conversations that, again, we've never had those before. Our relationship with the UW is a relationship that doesn't quite go back to 1955, but it goes back to when we signed these agreements. We built buildings with the promise that the UW would teach within them, with no return to the county of any of the revenue associated with that education. And these, again, those agreements are not unique to the county. They're all the same. Every two-year campus around the state of Wisconsin has this pretty much the same agreements. But to your point, it sets up, or to my point, I guess, it sets up a relationship that is ripe for revitalization and improvement. So a lot of conversations, as Chris said, this is a starting point of a list. We know we're not going to be able to move forward with all these, but my suggestion as you look at this is if there's a project on here that you just know, but this is a no-go. We, as a policy direction, we don't want to do this. That's the good stuff for for administration to know now. Because then we can start to look to those other funding areas and allocate suggested funding for you to examine. But it's really nothing other than that. This is not an approval of all these projects. We know we're not going to be able to fund them. As Chris said, we don't have enough money. You were very clear, you gave direction. There will be no dollar amounts in that gray column in the middle. You gave us that direction. We're not going to borrow. So it's that, are there projects on the list that are truly, like, this doesn't make sense to do this now, give us that direction and we can kind of push it out in the plan or get rid of it completely.
Supervisor Marshall.
Thank you, Mr. Chair. I was just going to ask if we could have you send out that CIP detail that was included in our August 9th HR Finance meeting, just because that had priorities and might be able to answer people's questions. Thank you.
Just to clarify, like the project request forms and all those? Sure, yep. We'll send an email directing people to where to find them in the packet.
Okay, next we have Supervisor Marash, please.
Thank you, Mr. Chair. Just a couple real quick questions. Which playgrounds are left to be replaced?
We have the Director of Parks, Jamie Polly, please.
Thank you. We just started replacing the county playgrounds, so we have 5 of them replaced. We need to replace 2 in Marathon Park, Amco Park, and Big Rapids Park, and I believe there's 1 more. So I think we have 4 more to replace.
Thank you. The UW boiler, you said you're pulling that away from fuel oil. What would you be using, natural gas? And then for the bathrooms for the Parks Department, upgrading those, and then the camper cabins, I'm wondering if you did any kind of return on investment study or have any data on that. And in addition to that, what about the staffing it would take to clean all of those, and would we have increased liability insurance?
If I can talk to part of that, the HR Finance Committee has requested that we do a financial feasibility and analysis and return on investment. It hasn't been done yet, so HR Finance moved it forward with the understanding that we are going to actually do that feasibility and financial return on investment.
And we can roll those other questions you just brought in into that.
Supervisor Sandowski.
Yeah, I just got a question. Like some of these I've seen on last year's budget. How does that work with the funding in that? Is there money left over from last year's budget for some of that, or because I know we passed some of that in last year's budget? Or I'm just curious how that works out. If you could explain that.
Which ones are you speaking to specifically?
I don't know. I've seen some of them on here. I think the HVAC one was on, wasn't it? The chillers.
Oh, the chillers and HVAC. So yeah, that was the design component to get everything, to basically take the concept of what the change is, get the schematic design to overhaul the entire system, and then have that inform the final construction cost estimate for the equipment you would need, and so on and so forth. Okay. So yeah, it's back to earlier conversations we've had about, where it was Supervisor Shafinsky and Supervisor Baker were asking about, well, this is a rough number. what's the actual number? And so like, that's what we've done with the TRC and the Lakeview project. But last year was still in that mold where you said, okay, the first phase is getting that rough estimate piece for the design. So now we're trying to get, when we bring things forward, to say, here's the real ballpark figure. We know it's not dialed in, but we give you a range. And then this is actually informed by step 2 of the design, then to build process. So that's why you're seeing it again.
Okay, thank you.
Supervisor Stravinsky, please.
Thank you, Chair. So to return to ARPA for a question, and I don't know if we're going to have a definitive answer tonight. We know that ARPA funds cannot be used for debt servicing. Do we have a position, can ARPA funds be used instead of tax levy funds to, replace tax levy funds that we would otherwise use for county operations? I'm not sure how to say that better, but basically to fund county operations, and then those tax levy funds are available for other purposes.
And that's what I was trying to allude to before, in having, excuse me, in having those discussions at NACO and having those discussions at WCA. They strongly encouraged against that kind of supplanting tax money that is currently used to fund operations with ARPA funding and then using that savings to in turn cover debt service. That is strongly discouraged because it's contrary to the intent of the law. The intent of the Treasury's regs were you cannot use it for debt service. It was designed, ARPA was designed to be used to fund other shortfalls. And so, and they specifically said they did not want it used for debt service. So I think it goes contrary to the spirit of the law, and so it's strongly discouraged from doing that, is the real point. And so if Marathon County were to be reviewed and audited on ARPA funding and use, and that were one, it may rise to the level of at least review and question.
Can I add one thing, Mr. Chair? But to your point, I think there's a real, there's the opportunity is to get to that point where you're limiting taking on additional debt. You can absolutely use ARPA in the context of if it falls within that lost revenue area for the capital projects we're talking about. So you negate having to take on any additional debt that you might otherwise, which also allows the opportunity for some of the projects that Chris talked about. I'll just pick the library, for example. The investment using ARPA not only would preclude you if you only could do that through borrowing. You don't have to do that. You also get the benefit of the utility costs, your operating revenues. You do get the kind of the windfall of those operating revenues. Excuse me, operating expenses. Sorry, it's late. Operating expenses coming down so that you can then repurpose those for any purpose that you're alluding to. I hope that's helpful.
So I'm running out of power on my computer. Clarify that. Any other questions on the CIP resolution and the CIP projects? All right, we will move on to Public Safety Committee, a resolution under item 9C, 5A, a resolution recommending the provision of funding for Judicare mediation, the women's community, North Central Community Action Program for 2024 annual budget, resolution 46-23. Any questions? Supervisor Baker.
Thank you, Chair Gibbs. So Supervisor Wilhelm is not here this evening, but he is planning to make the same amendments as Supervisor Valley made for this resolution, which would be allowing the administrator the flexibility to keep the funding the same or reduce it by 8%. And the same language was passed by EED for our resolutions supporting Historical Society and McDevco. And the idea is not that we are trying to reduce the spending, but if we need to cut spending within our departments, we want to provide the flexibility to reduce the nonprofit spending by the same amount. And at EED, Administrator Leonard said he actually preferred the revised language over the initial language. So thank you.
Any other discussion? Okay, Supervisor Dickinson, please.
Thank you, Mr. Chair. I just had one question. The North Central Community Action Program is in 2 resolutions. I don't know if that creates an issue. It's in one of the previous ones. So I don't know if this gets to what Supervisor Drabeck was saying about dividing the question, or if, there's part of that, but also it's in 2 resolutions.
Corp Counsel, please.
My guess is the reason is there are 2 different committees that have oversight or interaction with North Central CAP. What I would say is I would encourage the board to use, if you're passing 2 different resolutions that address the same nonprofit, use the same language. So don't have one say 8% and the other not. That's just a suggestion. A strong suggestion.
Okay, any other discussion? Okay, moving on to item 9C6, Human Resources, Finance and Property Committee, Environmental Resources Committee, and Parks Commission. Under item 9C6A, a resolution approving the land exchange to establish the Dells of the Eau Claire property line. Resolution 47-23, and we have the Parks Director, Jamie Polly, here for any questions. Any questions? If you watched the ERC committee and the Finance and Property Committee, you had an explanation as to why the lines were not where they were thought they were. And part of our toilet is in the wrong place. So the land swap has been agreed to by both the property owner and Marathon County. Supervisor Marash, please.
Thank you, Mr. Chair. I just wanted to thank the landowner for spending so much time with us this evening to answer any questions in case we had them, and for your flexibility in working with us. Thank you.
I used to be a school administrator, so I know how this works. As a superintendent of schools.
Well, thank you for your service, and thank you for, again, your patience. Moving on then to item 9C, 6B, a resolution approving funding for the ice arena feasibility study for concept planning, resolution 48-23. Questions? Supervisor Drabeck.
Thank you, Mr. Chair. I voted against this there at ERC, and it mostly just seemed to me like, okay, if I'm looking at a new car and I can't really afford to buy it, I shouldn't be walking around kicking the tires. I maybe just should leave it alone. And that was kind of one of the things that was on my mind there. So, thank you.
Supervisor Baker.
Thank you, Chair Gibbs. So I just wanted to make a couple comments of where I'm at on this. In my district, we have both Mosinee School System and DC Everett School System. And I think the Central Wisconsin Storm, which is a girls' joint hockey team, uses this facility. So I think my residents see value in this, or my constituents, I'm sorry. However, I wouldn't support the resolution as it is written, but I would support a resolution that limits the county's contribution to 15%. 15% for this grant funding, 15% for the capital costs. So if it was rewritten, so that would be, and you know, I realize that this part is really not very much money, but I think we're setting a precedent. So if we would limit, you know, our contribution to would be 4,800, I think it is. And I think if we can raise the other 8,000, I don't think that would probably be that difficult. If we can't raise 8,000, we're not going to be able to raise the 20 million, you know, that we're going to need in the future. You know, I don't see this being paid for by the county totally, but I'm fine with the 15%, and I'm fine with the Parks Department heading it up and spearheading it. So thank you.
Supervisor Langenhahn, please.
Thank you, Mr. Chair. And I want to address the previous couple points. I am very open to having discussions about the county's role in a potential project like this. It's the reason why I supported this at the Environmental Resources Committee. Just to give you an idea, at the beginning of the budget process at the standing committee level, I was talking with Director Polly about the ice rink facility. And here are the user groups that use it. There's a Community for Open Skate, Wausau Youth Hockey, Wausau Cyclones, NH3L Hockey League, Timberline Figure Skating, 2 adult hockey leagues, Wausau West Hockey, Wausau East Merrill Hockey, Storm Girls Area Co-op Hockey, and then there's various other rentals such as the Sisters of Skate and the Wausau Virtual Academy and Circus. Then the other point I wanted to bring up was that ice rentals are the 3rd highest revenue source for the Parks Department, which would be $220,000. Timber sales is number 1 and camping is number 2. Really what I want to communicate to the board is that something is going to have to be done about this building at some point. I mean, this building goes all the way back to 1973, I want to say, when the county got it from Eagle River. I think that it's worthwhile working with the community groups to determine what the county's role might be. If that's the county only providing 15% of the cost for the study, that's perfectly acceptable to me. Of course, we would have to go back to those community groups and have some further discussions. Really, the way that I view this study in particular, I don't view it as something that commits the county to building a multi-million-dollar facility for ice skating. You know, I think there's some public finance questions there about, you know, does a county taxpayer's dollar that goes into the budget, does every single dollar that gets put in see a benefit from that ice rink? You know, I think there's some discussions that need to be had there. Really what I hope this study does, and I trust that this study would do, is give the county a list of potential options of what it could do with the facility. Would the county possibly move on from such a facility, not provide that in the future? It's not a mandated service. You know, and it's something that maybe the school districts would decide to take over, you know, or does the county, you know, decide to go through with such a project? Although I shared similar concerns as Supervisor Drabek that, you know, I don't believe the county is in a position right now to afford such a project. I guess what I'm trying to say is that, you know, between now and I'll definitely listen to discussions on Tuesday, if the wish of this board is to send this back to the Park Commission to have some more engagement with those user groups, I'm very open to that. I just really want the board to realize that, hey, this is an asset of ours. We're going to have to make a decision at some point. Let's weigh all of our options. Thank you, Mr. Chair.
Thank you. One of the things that, when it was brought to HR Finance, I think one of the things that we have to be cognizant of is, one, the age of that facility and the contractual obligations that we have to the user groups and in some cases the semi-pro facility, the semi-pro team that is utilizing that. And the thing that I look at when I look at this study, what it does is provides some options and draws some conclusions as to how, if at all, we move forward. And I'm not saying that I'm on board moving forward if the county is going to be funding a major portion of this. I think we have seen that there's major user groups out there, and the user groups have, and I am very thankful for the user group stepping forward and bringing some funding towards the use of, or towards the study itself, and the I think the clarity that was provided to me was initially, I was looking at it that the 10,000 that the Parks Department was bringing forward was initially coming out of their budget. No, it's not. It's coming from donations. And so the 12,000, I think 500 is the request from ARPA from the county itself. Now, that being said, obviously that's more than 15% by Supervisor Baker's account. I don't know how we arrived at the 15%, but I think we need to look at how much use each of the various entities are utilizing the facility and how much the county is getting benefit from. But I think what the study will provide us is a roadmap that says, here's option A, here's option B, here's option C, here's option D. And if we don't have that, we don't have the information we need to make an informed decision as to whether we get out of the business, we stay in the business, but look at a joint funding operation, joint funding scenario, or fund it 100% ourselves. So I think that's what I'm looking for the study to provide, is clarity around what the next steps are, because that facility clearly has some challenges with equipment that was used when we got it from 1973 and maintaining it moving forward. Ms. Polly has a couple of things that she'd like to present to the board.
Thank you, Mr. Chair. Just wanted to add, and I kind of sat back to see what kind of questions there were. But as we bring this forward, the county had decided when this was built in 1974 that there was a need for ice rinks, and that's why these two were built, one in 74 and one in mid-80s. They were built basically as pole buildings. They're seasonal use. They're not a year-round use, and there's no way of making them a year-round use. They're heavily used right now. There is a demand for that ice. Everest can't take on any more when it comes to the off-season ice. They're the only year-round facility we have in the area. So based on the age and the number of mechanical and structural needs that the buildings have, this study will really address what this looks like going forward. And it will look at whether the county stays as the facility manager to do this, or whether it does go somewhere else. I think that's very critical. It will look at the public-private partnerships. It will look at all the user groups and what their needs are. They will come to the table. It will be. I've gone through this same process already once in my previous position. So, and with this company that would be doing it. So I'm very comfortable that they're very thorough. They do know what they're doing, and they're very knowledgeable of the ice industry. So they will take the user's needs and wants and put them into a facility to really show what that would look like. They'll look at the county's needs and wants. They'll look at the economic impact of this facility. They'll look at our current operations. Right now, our current operations are encompassed within our operating budget. So it's very hard to pull out exactly what our operational expenses are for this facility. We do have the revenues for ice set aside specifically, so that is easy to pull. From the number crunching that I've done and looking at all the specifics within our budget, right now we currently have an 80% cost recovery on that facility. And that's an estimated because it's within our general operating. And that's with it only being seasonal. There is a high demand for at least one sheet year-round, whether we have it or not within this community. So there's a higher potential to have that be a facility that could operate in the black, depending on those demands. And that is what this feasibility study will look at. It looks at those needs. It will look at all those user groups and really get down into dirty of how much are they willing to commit to, whether it's capital, whether it's operating. We'll be looking at contracts long-term. One of the examples when I did it in Minnesota is before we went forward with an ice arena, we looked at our youth hockey and said, to make this work, you will have to contract with us 1,600 hours for the year. And they were willing to sign that agreement, and they're willing to pay whether they use it or not for 1,600 hours. So all of our users pay for every hour of ice time. Even the open skate pays an open skate fee. So whenever the ice is in, it's paid for every minute that it is used. So it is a revenue generator, but that's the biggest thing of the feasibility study, is to really see what the needs of this community are. And not just with ice. It will look at these facilities and what they could potentially be when there isn't people skating on the ice. If we look at a 2-sheet facility like we have now, realistically, only 1 sheet will have ice in it year-round until the demand shows that you would need it for 2. So that means you have a facility that will be programmed for other uses. So we'll look at what those are, whether it's concerts, whether it's Sisters of Skate, whether it's expos, whether it's other facility rental type of activities that we could have out of there. That will all be part of this study and what that economic impact would be. And then it will give us an idea of what that facility looks like and then what that actual dollar amount is. And then we determine, where we move forward. It definitely is going to have to be a public-private partnership facility going forward. It is a community facility. Our youth hockey, even though it's called Wausau Youth Hockey, has kids from Edgar, Athens, Hatley, all around. It's not just Wausau Youth Hockey. There is only Wausau Youth Hockey and Everest Youth Hockey. So the youth in this county play for one of the two. They don't necessarily have to live within those districts because it's a club team. So I just wanted to point that out, that that's where this study comes. Thank you, Chair Gibbs, for clarifying the funding. We have had user groups that have come forward and willing to provide funding for it, and that $10,500 that I do have out of our budget is from donations from trust funds that are meant to go towards looking at the enhancements of the county's facilities and park systems. So we're using it for their mission, and we're not asking for that or using anything out of the levy at this point to get this study in place. So that is a little bit of background on the benefits of this study to really look at where we're going forward.
Administrator Leonard, please.
Sure, I just have one point, and I'm going to say something that everyone else has said. This study is not about committing us to build anything. One of the pieces of information that, as your administrator, I'm really interested in, selfishly, is the economic impact stuff, specifically sales tax. Marathon County does have sales tax generation as one of the revenues that you have to, by state statute, limit the property tax burden on local taxpayers. So if we better understand what the current economic impact is, we know just intrinsically that at that ice sheet, the ice sheets we have generate some level of sales tax. Some level of economic impact comes from that. So you're already getting some revenue. But I certainly would not wager a guess as to what it is. I know Jamie wouldn't either. Our hope is we get some level of understanding of what it currently is and what the future possibly is if you stay in the ice sheet business. But even if you don't, if you get out of the ice sheet business, it behooves us to know what that economic impact is, because unless somebody else steps forward to do it, you will lose it. And I can't tell you if that's $100,000 a year, $500,000. I have no idea. But I think that's important for us to know. It's not just because we also get sales tax. The new shared revenue bill ties our shared revenue to sales tax growth. So it's one of those. It's one of those things. It's a good piece of information. Of course, it's a policy question for you, what the funding mix you want from the community is. But I just wanted to make that sales tax point, because that is, for the community to keep growing, it's a positive thing for property tax payers, because the more sales tax, the less property tax burden we have. It can negate borrowing. Certainly, we know that, and Jamie just alluded to this, right now we're not 100% cost recovery, and we're certainly not covering debt if we were going to borrow for this. So this study, there's a lot of potential good information that could come from it. If you want to give direction to staff to go back and have additional conversations, certainly we'll take that. But I do think there's some certainly good opportunity here.
Supervisor Marshall, please.
Thank you, Mr. Chair. You mentioned contracts and timeframes that we've committed. If you could share with us what those contracts that we have with those groups that are using it currently and when they would expire. And also they have the last or most recent private-public partnership that I can think of the county has done is the aquatic therapy pool, that we just said we are covering levy, and it's not even covering the debt as well as the levy. So I just caution to say, as well-intended as the studies were when we went and did that and said it could be a cost center without a levy, it hasn't turned out that way. Thank you.
Supervisor Baker, please. No, Jamie, excuse me, Supervisor Baker. Jamie, did you have some answers for some of the questions that were posed?
Yes. Well, the one long-term actual contract that we have is with, or not long-term, but is with the Cyclones. That's a 5-year. We have 4 more years left to go on that. And then we have an agreement. It's not. It's an annual agreement that we have with the school district, but that is pretty critical for the school district to know that if there is not going to be ice available, Wausau East, Wausau West, and Merrill, that co-op, has no place to play. So that's pretty significant to our school district. But all the other ones are annual, so they renew annually. Youth hockey renews annually. Our adult hockey is annual. And then one other thing I just want to throw out there is we have a lot of experience with aquatics too, and I can tell you aquatics facilities rarely ever make money. An ice arena, in my experience, can if you program it correctly and the need is there. It definitely needs to have the demand.
Supervisor Baker, and thank you for allowing me to interrupt you. Supervisor Baker, please.
No problem, thank you. So in response to the question about where I came up with the 15%, I got that from 2 places. One was from the Regional Forensic Science Center. The model that we basically have used is we're investing $2 million out of 14. So that's not quite 15%, but I rounded up to be generous. And then the other is Jamie's explanation that we're currently paying about 20% of the operating costs, so that the 15% would be in the ballpark of what we're contributing currently towards the operating costs. Thank you.
Okay, Supervisor Longhorn, please.
I just have one thing to add that I wanted to clarify with my percentage. So that numbers that I said about 80% is only our ice. That doesn't include any of the rentals we have in the MPB building. So I can have actually a better number for you on Tuesday. I just realized that as I was standing here. I definitely will not include the fair revenue in there, because if we did move this facility, the fair would not use it. But this facility is utilized like by the circus, Six Rows Skate. We have the virtual academy that uses it for a large rental. So, and that would still be available in a new facility. So I will include some of that rental dollars in there and give you a better figure. I just realized I had not put that in there.
Supervisor Longhorn, please.
Sure, Mr. Chair. Thank you. As far as the percentages, now I did some math here. You could probably tell because of the smoke coming out of my ears. But 63%, if you include the donation piece and then as well as the youth hockey, well, the 2 community groups' contributions, will get you up to 63% of what would be currently contributed. So that 37% would be the ARPA portion that the county would do. And like I said, I'm very open to having these discussions. Maybe one way to frame it is that going into the weekend, I just encourage you all to think about, what would you think is the ideal number to contribute towards such an endeavor with this study. The other thing I want to say is that I think determining the useful life of this facility is really important, because as we've previously discussed, we do have some current obligations, and I don't want to. Don't get me wrong. I don't want to pull this rug out from under Wausau School District hockey players. I don't want to do that. So I think taking the time to look at the existing facility, figure out what's the time frame that we're playing with, would be a really good idea. So thank you, Mr. Chair.
Supervisor Stravinsky, please.
Thank you, Mr. Chair. Kind of piggybacking on the elephant in the room about the life expectancy, or the extra service life out of the equipment, because we've probably gone long past its service life. One of the things that we need to do, I think, is provide direction that whether we have annual agreements or multi-year agreements, we need to make sure that everybody that we have agreements with, one, is clearly understands that this facility is on borrowed time and it may function for a year, a month, a week, a day, or 5 years. And we have no idea what really is going to happen. But at some point, what's going to happen is we're going to have I don't want to say a catastrophic failure, but we're going to have a major failure of components to the point where it is not repairable. And we need to make sure that the county is protected in that circumstance. And I guess I wonder, first of all, are we protected at this point in those agreements? And if we're not, then we need to take action to protect our interest. Not that we want to pull the rug out from anybody, but there may be a compressor or other piece of equipment that isn't going to listen to us, and it says, you know what? A week from Tuesday, it says, I'm done.
Let's hope not, but yes. Yes, and I have, Mr. Prierner looks at all of our agreements. We do have a clause in all of our agreements that says the county can basically, I'm not thinking of the word, but end the contract if we cannot provide the facilities or the funding. So let's say tomorrow or with this budget, you as a county board say, we're not going to give you any funding for ice arena operations. That's your choice as a county board, and we have a clause in all of our agreements that says if the county doesn't have that funding or the proper facility is available, that agreement is terminated. So we do have that already. Did I say that correctly?
Thank you very much for that clarification.
Okay, any other discussion? Any other discussion? Okay, we will move on to item 9C7, Human Resources, Finance and Property Committee, Health and Human Services Committee, a request for additional social services CLTS and CCS retained positions, Resolution 49-23. We have with us this evening, and she has been so patient to stay with us, the Social Services Director, Krista, with us, if there's any questions. Supervisor Marash, please.
Thank you. I'll try to be brief. I listened to your presentation a couple times, and I just need a little bit of clarification. It was mentioned that we have all of this backlog that needs to be submitted by, is it December 31st?
Thank you. So you're referencing, right, the backlog in regards to the submission for the funding. Yes, we have 1 year to submit all funding. So if we do case management today, we have until this time next year to submit for that. So we have not submitted for anything yet in 2023.
And we have until how long to do that?
1 year from the time of the service.
Okay, so we have some services that have been rendered at the beginning of the year, or even are we caught up from last year, or are we behind from last year?
I'm not 100% sure. We are definitely have not done anything for this year. I would say we are very close to the end of last year. If not, we have to be because of time frames. We only have 2.5 staff, which is why we're requesting additional staff for that position, because there's been a 141% increase in the program, and so that has really reduced the amount of time that our social workers, but additionally our accounting staff have had to process all of those pieces, and so that's why we're requesting the additional positions to ensure that all of the program, it is fully funded as long as we submit for that, to ensure that we can submit for that and that all of the program is fully funded. There is no tax levy involved in these positions.
Could you describe in a little bit more detail the different types of cases that you're seeing that there's been such an uptick?
Sure. So this request is for additional CLTS positions or Children's Long-Term Support Programming. Children who qualify for this program have physical disabilities, cognitive disabilities, and are not able to function in their daily lives without additional supports. And so all children who are referred to this program must be assessed. That's a requirement. Not all children are admissible into the program. They don't all meet the criteria. However, about 80%, Amber, is that correct? Higher than 80% of the children who are referred to us are eligible for those services. And once they're eligible for services, they are re-evaluated every year. But because it's typically a physical disability or a cognitive disability that doesn't go away, they remain eligible through their 18th birthday, and if they're not moving forward to adult services, through their 22nd birthday.
And then just one final one, because it's the middle of August and we've got till December 31st typically, I was just curious why it was postponed to this point to bring this forward, to request the additional positions.
That one. Well, I asked for staff to do all the evaluation, so if you watch the presentation, there's like, I want to have the data for all of you to know what the need is. And on top of that, you have a very specific process through which new positions go. New positions under ordinance 4.20 are first evaluated. I have a conversation with Krista, which we had. I had questions for her to follow up on, which she and her staff did. Then we took it to Social Services Board, Health and Human Services, HR Finance, and now it's here. So that has taken a little bit of time. I'm not overly concerned that we're going to have any write-offs. I mean, I get the concern that the financial will be there. We'll be able to get people hired. I'm confident. Our plan is not to onboard all of the staff at once. I mean, that's a that's a heavy lift. We're going to focus on the kind of the most pressing areas first, which are the financial administration piece, the staff in terms of staffing leadership, so the lead person, and then 2 social workers, so that we can address some of the backlog, get everyone up and trained before moving on to that second batch. The short answer, that took time, and I don't approve position requests lightly. I think that would be a critique all of the department heads would give me, is that I know that our goal is to be as efficient as possible. You gave direction as part of this year's budget to not have any new positions. So I hear that. I scrutinize everything. So I ask a lot of questions. So if there's a reason that it's slowed, it's me, because I ask those questions.
I would also just share, in addition, I've only been your director since March of this year, and so there's been an evaluation period of what programs and people do we need in place to make sure that we are effectively running the programs and that we're in compliance with the requirements that DCF, and in this situation, DHS has set for us.
Okay, any other questions? I've got Supervisor Baker next.
Thank you, Chair Gibbs, and thank you for the thought that it was evident that you put in the previous presentations. I appreciated that. I have probably 45 minutes of discussion. I am not joking, unfortunately. I would like to ask if that could be deferred till Tuesday.
Yep. Corp Counsel answers the question.
You can, so this item will be up for debate on Tuesday, so certainly you'll have the opportunity to take the floor during debate.
Will I have the opportunity to ask questions to the director?
If the director is available on Tuesday.
I will be available.
Okay. Would you prefer that I do it on Tuesday?
Whatever is the pleasure of this board.
I'll offer up something too. If you have specific questions, we can talk to you after.
No, I would like, it needs to be the board. It's questions that just if you and I discuss, then the board doesn't get to consider.
Understood.
So what's the pleasure of the board? Wait till Tuesday, or should I go ahead?
silence is golden. I guess I would suggest that we have the individual here. Go ahead and ask
Okay.
your questions.
Okay, thank you. So I think that almost everyone, if not everyone on the board, thinks that taking care of disabled and handicapped children is essential for our county. One question, the main thing that I didn't see in the presentations was any kind of analysis or questioning as why are we having 21% increase in 4 months of increase in these cases. And I went on the website and I looked, I read different, I went on the state website and looked at tried to educate myself. And I think there's a number of different potential reasons. I wrote up an amendment that I sent to you and the board, potential amendments. And it looks to me like root causes could include changes in environmental factors, changes in the program eligibility requirements, changes in eligible referral sources, an influx of eligible children into Marathon County, and potential vaccine injury of children or parents. I would like us to address that we're not going to continue to have this kind of increase in our number of handicapped children, number of disabled children in the county. And so what I'm proposing is that we would fund, or that we would approve one social worker position and one accounting specialist position at this point. And that's certainly up for debate. It can be higher than that. But then that we would, before we approve more, I have a list of data that I'd like to receive that come back to the Social Services Department. Come back to the Committee of Jurisdiction, the Human Services Committee. And I won't read all those tonight. I did copy it so you can see, and if there's additional data points, but really I'd like to get to where we can say what are those causes. This data I think would help us get to that, to what are the causes for this. So a couple specific questions. The program was initially set up that it was for children that would be institutionalized if it wasn't for this program. Is that correct? Is that accurate?
The very beginning of the history of the program, that would be correct. Yes.
Is that
and
still
the goal of the program is to keep our children here in their homes and in our community. That's
Is that
accurate.
still the case?
That's correct.
It's still the case that to be eligible for the program, that the children have to be assessed as they would be institutionalized without the program?
They have to have a need that limits their daily functioning, that rises to the level that DHS has set for them to be eligible for the program. So their daily functioning must be impacted by their disability.
So in the new, so there's a 2-page paper on the website that says what the changes are from prior programs, and it looks like those requirements have been perhaps loosened, that to allow for assessment of more children. Would that be an accurate statement?
If the board wouldn't mind, I have Amber Pax here, who is the direct supervisor of children's long-term support and has direct field experience in that program.
Okay.
She could better speak to that
Okay,
specific
that would be good.
question. Yes.
I just want to make one clarification, and that is we don't institutionalize any children anymore at this point.
Okay, I didn't mean to say
No,
institutional.
I get that. I just
Yeah.
want to make that.
So I clarify that. Well, clarify what would be in a hospital or, okay. So that's a good, I would like to have clarification on that then.
Okay, sure. So the functional screen, to my knowledge, has not changed the requirements. Children qualify in 3 different target groups. So there's a mental health target group, there's a developmental disability target group, and there's a physical disability target group. So yes, some of those children would otherwise be in like a nursing home level of care.
Okay. And that, what, have a change in requirements, would you say that it has impacted the number of children that are assessed, that are coming in as being requested to be assessed?
That are being found as eligible? Or
No, the request, the backlog, the 78 children backlog. I mean,
So I think that's a difficult question to answer because referrals come to us from a variety of sources. They could come from a medical provider, they could come from a social worker, they could come from a teacher. And this is sort of my opinion, but diagnoses, particularly of mental health, we have all seen that increase, right? I don't think that's anything new. How that impacts then physical health and all of those different pieces, I think there's a lot of uncertainty. We're not really sure why there's so much influx in children with disabilities, but we do know that that is consistent across the state. In every meeting that I have with state providers in other counties, they're talking about why are there so many cases coming in? And then why are all of these children eligible? That's not a decision point that social services makes necessarily, that child is disabled. That has to be a decision point made by a provider. So a social worker doesn't say, yes, child A, you are disabled because I am diagnosing you with this disability. That disability diagnosis must come from a medical provider. Does that help?
a little. Okay. And then also, if you can provide where it says in the resolution that this is funded in the state budget. And if you can provide some additional information on where that is. It doesn't have to be at this moment.
Sure, I can answer that pretty briefly. So CLTS is fully funded by state and federal budget. And so how all counties do this is we calculate what our case management rate would look like, taking into account all of our overhead costs, including some of our administration, supervisors, and then we share that cost with the state who then approves it, the state being DHS. That then gets sent through to a third-party provider who then reimburses us. So DHS approves the rate that we calculate to ensure that this is a fully funded program. And they have provided additional funding to ensure continuous enrollment, meaning that when a child comes up and say there's a referral to see if they're eligible, that once determined eligible, they must automatically move into case management services. There was a period of time where children were coming to us as a referral. We would determine that, yes, you are eligible for services, and then they would sit on yet another wait list to actually receive those services. And so in 2021, DHS said you must move forward with continuous enrollment. You must, once you assess that they're eligible, you must provide that, and then they have subsequently increased their funding to ensure that you're able to do so and approve rates.
Okay, that didn't answer my question, but I'll take that offline. Thank you. Okay, I'm probably have more questions, but I'm not going to. I will ask later. Thank you.
Thank you.
All right, any other questions? Any other questions? Supervisor Dickinson, please.
Thank you, Mr. Chair. So a couple questions real quick. Just looking at the math in the resolution, 16 social workers, 463 youth. That ends up being 29 cases per worker. You state 33. Where's the difference?
Yeah, so there are 33 cases, and I think that's differentiation between families, which might make a difference. Some of these children are dually eligible for CCS and CLTS services, and so that's probably where that differentiation is coming, is that they're dually eligible for both. And we do count them as two cases and not families because they are very distinctly different programs. CCS is run by North Central Healthcare, as you were made aware of earlier this evening, and then we are a contracted provider of that. We are the CLTS waiver program through Marathon County Social Services.
Okay, second question then. It states in here that there is an increase, projected increase of 141% from 2019 to the end of 2023. First question is, has that happened? Second, what's the projection beyond 2023?
I don't have the projection for you beyond 23. If you would like that for Tuesday, I could certainly work on that. That's a projection that our finance supervisor put forward based on the number of referrals that we were receiving and that we're anticipated to receive as indicated by DHS.
Okay, last question. How long is a child on a wait list?
Yep, our average wait list time is 5 months.
Thank you.
And one other clarifying point. The state has directed us that there be no wait list, correct?
That is correct.
And is there a penalty to the county if we continue to hold and have wait lists?
Yes, this DHS is able to put us on a corrective action plan, or any county on a corrective action plan if they're not in compliance. And so the goal here is to not be put on a corrective action plan by the state, that this board is taking that corrective action on our own, knowing that there's no tax levy involved, knowing that we are going to be able to make sure that we submit those payments. We're going to be able to hopefully not have to increase tax levy in the future, because these children have such specific needs, and they're really complex. And oftentimes these are the children that end up in out-of-home placement through Child Protective Services because their families don't have the resources and supports that they need. And so by offering these services up front, you reduce the need for out-of-home care, you limit tax levy, you limit trauma, you limit all of those different pieces from adding supportive positions that don't cost this county any funding.
Supervisor Dickinson, please.
Just a follow-up to that then. We've had children on the wait list before, correct?
Correct.
Have we ever had corrective action from the state put against us?
This went into effect in 2021, and as of this point, we have not had corrective action put in place.
Okay, thanks.
You're welcome.
Any other discussion? Okay, we are down to announcements and/or requests. The Administrator Leonard had an announcement.
I'll be real quick. So during the discussion of the CIP project potential plan list at HR Finance, there was also a brief discussion about potential funding available. And in that discussion, we talked about the CIP rolling over into this year's budget, which we talked about in the budget education. In that conversation, I referenced the amount of the rollover being approximately $2 million. And I also referenced that amount would have been impacted by the board's decision through the budget process to spend reserves, which you all recall. The amount I referenced is accurate. The fact that it was impacted by the board's decision was not. So I just wanted to make everyone aware, if you watched the HR Finance meeting, that was a misstatement on my part. I'm actually having Christy at the next HR Finance meeting do a brief overview of how that rollover is calculated. The spend down of reserves in connection with this year's budget will have an impact on the 2025 budget, but not this budget. So that's my first announcement. My second one is I will not be attending your meeting on Tuesday. I am going to be taking my family on vacation. I will be checking email, so if you do need anything, I should be able to respond, but Chris will certainly be, Chris and the rest of the staff will be able to handle everything. I will attempt to attend virtually, but just wanted to make everyone aware of that.
Okay, any other announcements and/or requests? All right, Supervisor Drabeck.
Thank you, Mr. Chair. I just wanted to let everybody know that the Athens Fair, I guess, is on this weekend. So if anybody wants to go there. And the steam show, Edgar Steam Show will be on, but I'm not going to give the dates to that because every time I do it rains a lot. So.
Okay, any other announcements and/or requests? Supervisor Niemeyer. Okay. All right, we're down to item number 11. Nobody wants to. Supervisor Langenhan with a motion, Supervisor Cavalli with a second to adjourn. Any discussion? All those in favor of adjournment signify by saying aye. Aye. Opposed? Motion carries. Thank you. We stand adjourned. Thank you, ladies and gentlemen.